Reflux, Knowledge and Healing Understanding and Therapy with 250 pages. Valentin Duquesne. A little introductional story. Katharina sat in her favorite spot by the window and stared out at the gray sky. She felt an unpleasant pressure building in her throat, accompanied by a slight burning sensation. It was a familiar feeling that had accompanied her for years. Silent reflux. When she first learned about this invisible burden, she was just in her 20s. It began with an occasional cough and a constant need to clear her throat that she couldn't shake. She initially thought it was just a temporary occurrence, perhaps a reaction to the stress of her studies or the adjustment to a new diet, but the symptoms persisted and even worsened over time. She still remembered the day she finally mustered up the courage to see a doctor. The diagnosis was silent reflux. It was like a slap in the face. She had heard about heartburn, stomach ulcers, and other digestive problems, but silent reflux was completely unknown to her. The doctor explained that silent reflux occurs when stomach acid flows back into the esophagus without causing typical symptoms like heartburn. Instead, the condition often manifests itself with coughing, clearing of the throat, and hoarseness, just like Katharina's. In the years that followed, she learned to live with her silent companion. She tried various medications, followed diets, and attempted to reduce stress. Sometimes it seemed to get better, only to then worsen again, as if the reflux had taken on a life of its own. But Katharina didn't give up. She scoured the internet for information, read books, and talked to other sufferers. In doing so, she came across countless stories of people who had lived with silent reflux for years, not knowing what it was, until they finally received a diagnosis and found help. But there were also those who did not let their suffering get them down and explored new ways of treatment. Katharina read about alternative therapies, about special exercises for strengthening the diaphragm and esophagus, breathing techniques, and dietary changes. A spark of hope ignited within her, and so Katharina decided to no longer passively watch as reflux controlled her life, but to actively take action against it. She began changing her diet, avoiding acidic foods, and learning to eat and drink more consciously. She took yoga classes to reduce stress and practiced daily breathing exercises to strengthen her respiratory system. It wasn't an easy path, and there were moments when she despaired and felt like giving up. But she remembered the stories of other sufferers who had managed to overcome their silent reflux. Inspired by their courage and determination, she kept fighting. Today, years later, Katharina still sits by the window, gazing at the sky, but the pressure in her throat has disappeared, as has the burning. She takes a deep breath and smiles. The silent reflux may have been a part of her life, but it no longer dominated it. She had learned to live with it, and ultimately overcome it. Katharina's story is just one of many. It represents all the people out there struggling with silent reflux and searching for hope. Because even if the path is rocky and the burden sometimes seems heavy, there is always a way to see the light at the end of the tunnel. In this book, we want to show you that you are not alone. We want to provide you with information and advice to help you understand and treat your silent reflux, and ultimately live a symptom-free life. Because everyone deserves to breathe freely and live without fear of the next attack. Join us on this journey and let us defeat the silent companion together. Welcome to the world of new therapy for breastfeeding reflux. Introduction written by Helene von Waldreben. What is silent reflux? Silent reflux, also known as laryngopharyngeal reflux, LPR, or extraesophageal reflux, is a form of gastroesophageal reflux, GERD, characterized by the backflow of stomach acid and contents into the upper airways and throat. Unlike classic GERD, in which heartburn is the dominant symptom, silent reflux often does not cause typical stomach upset. Instead, the effects of reflux are primarily noticeable through symptoms in the throat. The causes of silent reflux are varied and can include anatomical, physiological, and lifestyle factors. The most common causes include weakness of the lower esophageal sphincter, LES. The LES is a muscle at the bottom of the esophagus that normally prevents stomach acid from flowing back into the esophagus. Weakening of this muscle can allow stomach acid to more easily enter the upper airway. Hiatal hernia. A hiatal hernia is a condition in which part of the stomach protrudes through the diaphragm into the chest cavity. This can impair the normal closure mechanism of the esophageal sphincter. Dietary habits. Consumption of acidic foods and drinks such as citrus fruits, tomato products, coffee, alcohol, and spicy foods can aggravate reflux. Obesity. Obesity increases pressure in the abdominal cavity, which can promote the reflux of stomach acid. Smoking. Smoking can decrease the production of saliva, which normally neutralizes acid and protects the esophagus. It can also weaken the LES and impair stomach movement. The symptoms of silent reflux can vary, but they primarily affect the throat and pharynx. These include chronic throat clearing, persistent cough, especially at night or after eating, hoarseness or changes in voice, globus sensation in the throat, the feeling of a lump or foreign body, sore throat or chronic sore throat, difficulty swallowing, sore throats or inflammation of the vocal cords. Diagnosing silent reflux can be challenging because the symptoms are often subtle and can be confused with other conditions of the throat and pharynx. A thorough history, physical examination, and various diagnostic tests such as endoscopy, pH metry, or manometry can help confirm the diagnosis. Treatment for silent reflux aims to reduce the reflux of stomach acid and relieve symptoms. This can be achieved through a combination of lifestyle changes, medication, and, in some cases, surgical intervention. It is important that treatment is individually tailored to each patient to achieve the best results and minimize the risk of complications. In the following chapters, we will take a closer look at the different treatment options for silent reflux and help you develop a holistic approach to managing this condition. Causes and risk factors. The causes and risk factors for silent reflux are varied and can vary from person to person. However, there are some common factors that can increase the risk of developing this condition. Weakness of the lower esophageal sphincter, LES. The LES is a muscle at the bottom of the esophagus that normally prevents stomach acid from flowing back into the esophagus. Weakening of this muscle can allow stomach acid to more easily enter the upper airway. This weakness can be caused by several factors, including obesity, smoking, certain medications, and anatomical abnormalities. Hiatal hernia. A hiatal hernia occurs when part of the stomach protrudes into the chest cavity through a gap in the diaphragm. This can interfere with the normal closure mechanism of the esophageal sphincter, causing stomach acid to reflux. Overweight and obesity. Overweight and obesity increase abdominal pressure, which can facilitate the reflux of stomach acid into the esophagus. Furthermore, Excess fatty tissue can produce pro-inflammatory substances that can exacerbate reflux. Dietary habits. Consuming acidic foods and beverages such as citrus fruits, tomato products, coffee, alcohol, and spicy foods can worsen reflux. Likewise, large meals, high-fat foods, and eating meals close to bedtime can increase pressure in the stomach and promote the reflux of stomach acid. Smoking. Smoking can weaken the liver and reduce the production of saliva, which normally neutralizes acid and protects the esophagus. Furthermore, smoking can increase inflammation in the esophagus and impair gastric motility, which can worsen reflux. Certain medications. Some medications can relax the liver or increase stomach acid production, which can promote acid reflux. These include certain pain relievers, NSAIDs, calcium channel blockers, nitrates, antidepressants, bisphosphonates, and some antibiotics. Anatomical abnormalities. Congenital or acquired abnormalities of the esophagus or stomach can interfere with the normal flow of food and stomach acid and promote reflux. It's important to note that not everyone with one or more of these risk factors will necessarily develop silent reflux. The development of this condition depends on a variety of factors, including genetic predisposition, lifestyle, and environmental factors. However, it's advisable to be aware of these risk factors and, if necessary, take steps to reduce your risk of silent reflux. Symptoms and diagnosis. The symptoms of silent reflux can vary and are often more subtle than the symptoms of typical GERD, gastroesophageal reflux disease. Because silent reflux involves less or no heartburn, the symptoms are often not associated with stomach problems. Instead, they often manifest in the throat and pharynx, as well as in the respiratory tract. Here are some of the most common symptoms of silent reflux. Chronic cough. A persistent cough that doesn't respond to conventional treatment is a common symptom of silent reflux. The cough often occurs after eating and can be particularly bothersome when lying flat. Chronic throat clearing. People with silent reflux tend to clear their throat frequently, or for no apparent reason. This can irritate the vocal cords and cause hoarseness. Hoarseness or voice changes. Irritation of the vocal cords by refluxing gastric juices can lead to hoarseness or a change in the voice. This may be expressed as a raspy or deep voice. Globus sensation in the throat. Many people with silent reflux experience an unpleasant sensation in the throat, often described as a lump in the throat or globus sensation. It feels as if there is a foreign object stuck in the throat that cannot be swallowed. Sore throat or chronic sore throat. Irritation of the mucous membranes in the throat by refluxing gastric juice can cause a sore throat or chronic inflammation in the throat. Difficulty swallowing. People with silent reflux may have difficulty swallowing solid foods or liquids, especially if the reflux of gastric juice is acute. Coughing or wheezing at night. The coughing or wheezing may be particularly severe at night when the person lies down and the reflux of gastric juices is facilitated. Diagnosing silent reflux can be challenging because the symptoms are often non-specific and can be confused with other conditions affecting the throat and pharynx. A thorough history and physical examination are crucial to confirm the diagnosis. In addition, various diagnostic tests can be performed to confirm the diagnosis. These include endoscopy. In this examination, a flexible tube with a tiny camera endoscope is inserted through the mouth into the esophagus to check the condition of the mucous membranes and detect signs of inflammation or damage. pH metry. This test measures the acidity of the esophagus over a 24-hour period. Elevated acidity may indicate silent reflux. Manometry. This test measures the pressure in the esophagus and can help determine whether the lower esophageal sphincter is functioning properly. Barium swallow study. In this test, the patient is asked to drink a barium solution while X-rays are taken. This allows doctors to observe the flow of fluid through the esophagus and identify any abnormalities. Accurate diagnosis and treatment of silent reflux often requires collaboration between multiple medical professionals, including primary care physicians, gastroenterologists, otolaryngologists, and nutritionists. It's important not to ignore symptoms and to receive timely diagnosis and treatment to avoid long-term complications. The traditional treatment of silent reflux. Traditional treatment for silent reflux focuses primarily on reducing the reflux of stomach acid, relieving symptoms, and preventing long-term complications. Here are some common treatment methods. Drug therapy. Proton pump inhibitors, PPIs. These medications block the production of stomach acid and can help reduce the reflux of stomach acid into the esophagus. They are often the first choice for treating silent reflux. H2 receptor antagonists. These medications also reduce stomach acid production but are less effective than PPIs. However, they can be used in milder cases or for long-term treatment. Antacids. Antacids neutralize stomach acid and can provide temporary relief from heartburn and other symptoms. They are often taken as needed. Dietary change. A balanced diet can help reduce stomach acid reflux and relieve the symptoms of silent reflux. This includes avoiding acidic foods and drinks such as citrus fruits, tomato products, coffee, alcohol, and spicy foods. Eating smaller meals and avoiding eating immediately before bedtime may also be helpful. Lifestyle changes. Smoking cessation. Smoking can weaken the liver and promote gastric acid reflux. Therefore, quitting smoking can be an important measure for improving symptoms. Weight loss. Being overweight increases abdominal pressure and can increase stomach acid reflux. Therefore, losing weight can help relieve symptoms. Avoiding trigger factors. Certain activities or habits, such as spicy foods, carbonated drinks, alcohol, or certain medications, can worsen reflux. Identifying and avoiding these trigger factors can help reduce symptoms. Adjusting sleep behavior. Elevating your upper body while sleeping can help reduce stomach acid reflux. This can be achieved by raising the head of the bed or using a wedge pillow. Stress management and relaxation techniques. Stress can increase stomach acid reflux and worsen the symptoms of silent reflux. Learning stress management and relaxation techniques such as yoga, meditation, or progressive muscle relaxation can help reduce symptoms. It's important to emphasize that treatment for silent reflux should be tailored to each patient. What works for one person may not work for another. It's therefore important to work closely with a doctor or a team of professionals to find the best possible treatment and avoid long-term complications. In some cases, surgical intervention may also be necessary, especially if conservative measures are insufficient or complications arise. Medicines and how they work. Treatment for silent reflux often involves the use of various medications aimed at reducing the reflux of stomach acid and relieving associated symptoms. Here are some of the commonly used medications and how they work. Proton pump inhibitors, PPIs. Examples: omeprazole, pantoprazole, esomeprazole, lansoprazole, rabeprazole. How it works. PPIs inhibit the proton pumps in the stomach cells responsible for producing stomach acid. This inhibition reduces stomach acid production, which helps reduce the reflux of stomach acid into the esophagus. They are the most effective medications for treating silent reflux. H2 receptor antagonists. Examples: ranitidine, famotidine, cimetidine. How it works. H2 receptor antagonists block the action of histamine, a chemical messenger that stimulates the production of stomach acid. By blocking H2 receptors, stomach acid production is reduced, which helps reduce reflux. These medications are less effective than PPIs, but are used in some cases, particularly in patients with milder symptoms or for long-term treatment. Antacids. Examples: Marlux, Mylanta, Tums, Rolaids. How it works. Antacids contain alkaline compounds such as calcium carbonate, magnesium hydroxide, or aluminum hydroxide that neutralize stomach acid, providing temporary relief from heartburn and other symptoms. They work quickly but are not very effective at reducing stomach acid reflux and are therefore often used in combination with other medications. Prokinetics. Examples: metoclopramide, domperidone. How it works. Prokinetics promote stomach and digestive tract movement, helping to reduce stomach acid reflux and speed up gastric emptying. They are sometimes used to treat reflux, especially when delayed gastric emptying is also present. It's important to note that the effectiveness and tolerability of medications can vary from person to person. Therefore, it's advisable to work closely with a doctor to find the most appropriate medication and dosage for each individual patient. Furthermore, medications for the treatment of silent reflux should generally only be used for a limited period of time and should not be considered a long-term solution. Long-term symptom control often requires lifestyle changes and, if necessary, additional treatment measures. Lifestyle changes to relieve symptoms. Lifestyle changes play a crucial role in treating silent reflux and can help relieve symptoms and prevent long-term complications. Here are some important lifestyle changes that may be recommended. Dietary change. Avoid acidic foods and drinks such as citrus fruits, tomato products, coffee, alcohol, spicy spices, and carbonated drinks, as they can promote stomach acid reflux. Reduce your consumption of fatty and spicy foods, which can irritate the stomach and worsen reflux. Eat smaller meals and avoid eating large meals close to bedtime to reduce pressure in the stomach and minimize the reflux of stomach acid. Weight reduction. Overweight and obesity increase abdominal pressure, which can promote the reflux of stomach acid. Weight loss can therefore help relieve the symptoms of silent reflux. Quitting smoking. Smoking weakens the lower esophageal sphincter, LER, and increases gastric acid production, which promotes acid reflux. Therefore, quitting smoking can be an important measure for improving symptoms. Avoiding trigger factors. Identify personal triggers that may trigger or worsen your symptoms and try to avoid them. These include certain foods, drinks, medications, or certain activities. Sleep hygiene. Consider elevating your upper body while sleeping to reduce stomach acid reflux. This can be achieved by raising the head of the bed or using a wedge pillow. Avoid heavy meals close to bedtime and give your body enough time to digest the meal before lying down. Stress management. Stress can increase stomach acid reflux and worsen the symptoms of silent reflux. Learning stress management techniques such as meditation, yoga, deep breathing, or progressive muscle relaxation can help relieve symptoms. It's important to emphasize that lifestyle changes should often be considered part of a holistic treatment approach and can be used in combination with other treatment methods such as medications or therapies. Implementing these lifestyle changes often requires patience and commitment, but they can have a significant impact on controlling the symptoms of silent reflux and lead to long-term improvements in quality of life. The limits of conventional therapeutic approaches. Despite the effectiveness and widespread use of conventional therapeutic approaches to treat silent reflux, there are some limitations that must be considered. Medication side effects. While medications like proton pump inhibitors, PPIs, can be effective, they are not without side effects. Long-term use of PPIs can lead to an increased risk of bone fractures, kidney disease, vitamin deficiencies, and infections. Additionally, some people may experience unwanted side effects such as headaches, diarrhea, nausea, or stomach upset. Rebound symptoms. Sudden discontinuation of PPIs can cause symptoms to return, often in a more severe form. This is known as rebound symptoms and can increase drug dependence. Inadequate symptom control. For some patients, conventional treatment approaches may not provide adequate control of the symptoms of silent reflux. This can result in impaired quality of life and continued distress. Long-term dependence on medication. Some patients may rely on medication long-term to control their symptoms without exploring other possible treatment options or addressing the underlying causes of reflux. Risk of complications. Although conventional treatment approaches can help relieve symptoms and prevent complications, there is still some risk of long-term complications such as Barrett's esophagus, a precancerous condition of the esophagus, or esophagitis, inflammation of the esophagus. Individual differences. Each patient responds differently to different treatment methods, and what works for one patient may not work for another. It's important to consider individual differences and needs and offer tailored treatment. Given these limitations and challenges, it is important that patients and physicians be open to alternative therapeutic approaches and seek holistic treatment methods that can not only relieve symptoms but also address the underlying causes of reflux. An integrative approach that includes lifestyle modifications, nutritional optimization, stress management, alternative therapies, and, where appropriate, complementary treatments can help improve treatment effectiveness and achieve long-term results. Long-term effects of medication. Long-term use of certain medications, especially proton pump inhibitors, PPIs, can have various effects on the body. Here are some of the long-term effects associated with long-term use of medications to treat silent reflux. Osteoporosis and bone fractures. Long-term use of PPIs may increase the risk of osteoporosis and bone fractures, especially in older people or those with other risk factors for osteoporosis. PPIs may interfere with the body's absorption of calcium, which may lead to a reduction in bone density over the long term. Kidney disease. Studies have shown that long-term use of PPIs may be associated with an increased risk of kidney disease, including acute interstitial nephritis, an inflammation of the kidneys, vitamin and nutrient deficiencies. Long-term use of PPIs can impair the absorption of certain vitamins and nutrients, particularly vitamin B12, magnesium, and iron. Deficiencies in these nutrients can lead to various health problems, including anemia, fatigue, muscle weakness, and neurological problems. Risk of infection. PPIs may increase the risk of gastrointestinal infections, including infection with the bacterium Clostridium difficile, C. difficile, which can cause severe diarrhea. Increased risk of dementia. Some studies have found an association between long-term PPI use and an increased risk of dementia, although the exact mechanism of this association is not yet fully understood and further research is needed. Drug dependence. Long-term use of PPIs can lead to drug dependence, as abrupt discontinuation of PPIs can cause symptoms to recur, often in a more severe form. This can lead patients to continue taking PPIs even when they may no longer be necessary. It's important to emphasize that not all patients taking PPIs will experience long-term side effects, and the benefits of treatment often outweigh the risks, especially when PPIs are used short-term and under medical supervision. Nevertheless, it's important to consider the potential long-term effects of medications and explore alternative treatment options, especially for patients who must take PPIs long-term. Regular monitoring and communication with a physician are crucial to ensure the appropriate treatment for each individual patient and minimize long-term complications. Challenges in implementing lifestyle changes. Implementing lifestyle changes to manage silent reflux can present several challenges. Here are some of the most common. Motivation and perseverance. Lifestyle changes often require considerable motivation and discipline, especially when it comes to changing long-term habits. Giving up old eating habits or quitting smoking can be difficult, especially if the results aren't immediate. Social and cultural influences. Social and cultural influences can complicate the implementation of lifestyle changes. Social expectations, eating habits within the family or at social events, and cultural traditions can make it difficult to implement certain changes. Lack of time and resources. Adjusting your lifestyle often requires time, planning, and resources. Stressful daily routines and work commitments can make it difficult to prepare healthy meals, exercise regularly, or manage stress. Temptations and temptations. Temptations such as tempting foods, social invitations, or stress can cause individuals to deviate from their healthy habits and return to old ones. Lack of knowledge or support. A lack of knowledge about healthy lifestyle habits or a lack of support from family, friends, or healthcare professionals can make implementing lifestyle changes difficult. Frustration and setbacks. Frustration over lack of progress or setbacks can cause people to give up their efforts or feel discouraged. Psychological barriers. Psychological factors such as anxiety, depression, stress or emotional eating can hinder the implementation of lifestyle changes and impair motivation. It's important to acknowledge these challenges and develop strategies to overcome them. This may include building support systems, developing coping skills for stress and temptation, seeking alternatives to cultural or social influences, and implementing changes gradually to avoid becoming overwhelmed. A positive attitude, patience, and self-care are also crucial for success in implementing lifestyle changes. The new therapy for silent reflux. The new therapy for silent reflux is based on a holistic approach that aims not only to relieve symptoms but also to address the underlying causes of reflux and promote long-term health improvements. This therapy includes several elements that work together to reduce the reflux of stomach acid and improve the quality of life of those affected. Dietary optimization. A key component of the new therapy for silent reflux is adjusting your diet to avoid acidic foods and drinks, which can promote stomach acid reflux. Instead, a diet rich in fiber-rich foods, fruits, vegetables, and lean protein is recommended to aid digestion and soothe the stomach. Lifestyle changes. The new therapy also includes promoting lifestyle changes such as smoking cessation, weight loss for those who are overweight, stress management techniques, and optimizing sleep patterns. These changes help reduce abdominal pressure, regulate gastric acid production, and minimize acid reflux. Medication management. The use of medications, particularly proton pump inhibitors, PPIs, is often used more cautiously in new treatments for silent reflux. When medications are necessary, they are often prescribed for a short period of time and at lower doses to reduce the risk of long-term side effects. Naturopathy and alternative therapies. Naturopathy and alternative therapies can play an important role in the treatment of silent reflux. These include, for example, taking probiotic, dietary supplements to promote healthy intestinal flora, the use of herbs such as aloe vera to soothe the stomach lining, and the use of homeopathic remedies to relieve symptoms. Exercise and physical activity. Regular exercise and physical activity can help support the digestive process, regulate metabolism, and reduce stress, all of which help reduce stomach acid reflux and relieve the symptoms of silent reflux. Treating underlying causes. New therapy for silent reflux also emphasizes identifying and treating underlying causes of reflux, such as hiatal hernias, lower esophageal sphincter weakness, or anatomical abnormalities. This may require the integration of diagnostic procedures such as endoscopy, pH measurement, or manometry to determine the exact cause of reflux and enable tailored treatment. Overall, the new therapy for silent reflux aims to provide a holistic treatment that relieves symptoms, improves quality of life, and promotes long-term health improvements. By combining nutritional optimization, lifestyle changes, medication management, naturopathy, exercise, and addressing the underlying causes, people with silent reflux can receive comprehensive and effective treatment tailored to their individual needs. Basics of the new therapy. The new therapy for silent reflux is based on a holistic approach that aims to address the underlying causes of reflux and promote long-term health improvements. Here are some of the basic principles of this therapy. Individualized treatment. Every patient with silent reflux is unique, and therefore, treatment requires a personalized approach tailored to the specific needs, symptoms, and causes of the individual. This may include a thorough diagnosis and a comprehensive review of the medical history to develop the appropriate treatment strategy. Nutritional optimization. A healthy diet plays a crucial role in the treatment of silent reflux. Therapy includes optimizing the diet to avoid acidic foods and drinks that can promote stomach acid reflux. Instead, fiber-rich foods, fruits, vegetables, and lean protein are recommended to aid digestion and soothe the stomach. Lifestyle changes. Therapy also includes encouraging lifestyle changes such as smoking cessation, weight loss for those who are overweight, stress management techniques, and optimizing sleep patterns. These changes can help reduce abdominal pressure, regulate stomach acid production, and minimize acid reflux. Medication management. The use of medications, particularly proton pump inhibitors, PPIs, is often used more cautiously in new treatments for silent reflux. When medications are necessary, they are often prescribed for a short period of time and at lower doses to reduce the risk of long-term side effects. Naturopathy and alternative therapies. Therapy may also include alternative treatment approaches such as naturopathy, herbal medicine, acupuncture or homeopathy, which can help relieve symptoms and improve health without the side effects of medication. Exercise and physical activity. Regular exercise and physical activity play an important role in treating silent reflux. These can help support the digestive process, regulate metabolism, and reduce stress, all of which help reduce stomach acid reflux and relieve symptoms. Treatment of underlying causes. The new therapy for silent reflux places particular emphasis on identifying and treating the underlying causes of reflux, such as anatomical abnormalities, hiatal hernias, or weakness of the lower esophageal sphincter. Treating these causes can lead to long-term improvement in symptoms and health. Overall, the new therapy for silent reflux aims to provide a comprehensive and holistic treatment that not only relieves symptoms but also addresses the underlying causes of reflux and promotes long-term health improvements. By integrating nutritional optimization, lifestyle changes, medication management, naturopathy, exercise, and addressing the underlying causes, people with silent reflux can receive effective and tailored treatment that addresses their individual needs. Treatment methods in detail. Treatment options for silent reflux can vary and include various approaches aimed at relieving symptoms and treating the underlying causes of reflux. Here are some of the treatment options in detail. Nutritional optimization. Reduction of acidic foods and drinks. This includes citrus fruits, tomato products, carbonated drinks, coffee and spicy spices, which can promote the reflux of stomach acid. Avoid fatty and spicy foods. These can irritate the stomach and worsen reflux. Eating small meals. This reduces pressure in the stomach and can reduce the reflux of stomach acid. Avoiding meals close to bedtime. This reduces stomach acid production and minimizes reflux while sleeping. Lifestyle changes. Smoking cessation. Smoking weakens the lower esophageal sphincter and increases the production of stomach acid, which can worsen reflux. Weight reduction. Being overweight increases abdominal pressure and can worsen reflux. Stress management. Stress can worsen reflux, so techniques such as meditation, yoga, or progressive muscle relaxation are helpful. Sleep hygiene. Elevating the upper body while sleeping can reduce reflux. Drug therapy. Proton pump inhibitors, PPIs. These medications reduce the production of stomach acid and are often used for the short-term treatment of silent reflux. H2 receptor antagonists. These medications block the action of histamine, which stimulates the production of stomach acid. Antacids. They neutralize stomach acid and provide temporary relief from heartburn and other symptoms. Naturopathy and alternative therapies. Probiotics. They can support the intestinal flora and strengthen the immune system. Herbal medicine. Aloe vera, chamomile and ginger can have a soothing effect on the stomach lining. Acupuncture. This traditional Chinese therapy can help balance the gastrointestinal tract and reduce reflux. Surgical treatment. Fundoplication. A surgery in which the upper part of the stomach is wrapped around the lower esophageal sphincter to prevent reflux. Linx procedure. A procedure in which a small ring implant is placed around the lower esophageal sphincter to prevent the reflux of stomach acid. It's important to emphasize that the choice of treatment depends on several factors, including the severity of symptoms, the patient's individual needs, and the underlying causes of reflux. A comprehensive approach that includes nutritional optimization, lifestyle changes, medication therapy, and, if necessary, surgical intervention can often achieve the best results for patients with silent reflux. Collaboration with a physician or specialist is crucial to finding the right treatment and promoting long-term health improvements. Dietary change. Dietary changes play a crucial role in the treatment of silent reflux and can help relieve symptoms and promote long-term health improvements. Here are some key aspects of dietary changes for people with silent reflux. Avoid acidic foods and drinks. Acidic foods and drinks can promote stomach acid reflux and worsen the symptoms of silent reflux. These include citrus fruits such as oranges and lemons, tomato products, carbonated drinks, coffee, and spicy spices. It is advisable to avoid or limit your consumption of these foods and drinks. Reducing high-fat and spicy foods. High-fat foods such as fried foods, fatty meats, and high-fat dairy products can irritate the stomach and worsen reflux. Highly spicy foods and foods high in chili, garlic, or onions can also trigger symptoms. It's recommended to consume these foods in moderation or replace them with lighter alternatives. Eating small meals. Eating large meals can overload the stomach and increase abdominal pressure, which promotes stomach acid reflux. Instead, it's advisable to eat smaller meals throughout the day to reduce stomach strain and relieve the symptoms of silent reflux. Avoiding meals close to bedtime. Eating heavy meals close to bedtime can burden your stomach and increase reflux while you sleep. It's recommended to avoid large meals at least 2 to 3 hours before bedtime to facilitate digestion and minimize stomach acid reflux. Increase fiber and water intake. A high-fiber diet can help promote digestion and prevent constipation, which can increase abdominal pressure and worsen reflux. It's important to consume enough fiber from fruits, vegetables, whole grains, and legumes, and drink plenty of water to aid digestion and relieve the symptoms of silent reflux. Avoid alcohol and nicotine. Alcohol and nicotine can increase stomach acid production and relax the lower esophageal sphincter, promoting the reflux of stomach acid. Avoiding or reducing alcohol and tobacco smoke is recommended to relieve the symptoms of silent reflux. Switching to a healthy and balanced diet can make a significant contribution to the treatment of silent reflux, helping to relieve symptoms and promote long-term health improvements. It is important to identify individual trigger factors and develop a diet tailored to the individual patient's needs and symptoms. If necessary, Nutritional counseling or support from a nutritionist can be helpful in achieving optimal dietary changes. Breathing and relaxation techniques. Breathing and relaxation techniques can play an important role in managing silent reflux, as they can help reduce stress, relax the body, and relieve symptoms. Here are some effective breathing and relaxation techniques that may be helpful in treating silent reflux. Diaphragmatic breathing. This breathing technique focuses on breathing deeply into the belly rather than shallowly into the chest. Place one hand on your belly and the other hand on your chest. Inhale deeply through your nose, feeling your belly expand while your chest barely moves. Hold your breath briefly, then exhale slowly through your mouth while gently contracting your abdominal muscles. This technique helps relax your body and strengthen your respiratory muscles, which can reduce abdominal pressure. Progressive muscle relaxation. PMR. This method involves consciously tensing and relaxing various muscle groups in the body to achieve deep relaxation. Start with your toes and slowly work your way through your body, tensing each muscle tightly for about 5 seconds and then relaxing for about 15 seconds. Focus on the sensations of relaxation in your muscles and breathe calmly and evenly. PMR can help relieve physical tension and lower stress levels, which may counteract reflux symptoms. Yoga and Tai Chi. These practices combine breath control, physical movement, and relaxation techniques to calm the body and mind. Yoga and Tai Chi exercises can help improve flexibility, relax muscles, and reduce stress, which may help relieve the symptoms of silent reflux. Meditation and mindfulness exercises. Meditation techniques, such as focusing on breathing or repeating calming mantras, as well as mindfulness exercises that focus on the present and let go of negative thoughts, can help calm the mind and reduce stress. This can help reduce abdominal pressure and relieve the symptoms of silent reflux. Breathing exercises for acute symptoms. For acute symptoms of silent reflux, such as acid reflux or a lump in the throat, rapid breathing exercises can help reduce reflux. Try inhaling slowly and deeply through your nose and then exhaling slowly through your mouth while concentrating on the exhalation. Repeat this several times to calm your body and relieve symptoms. Regularly practicing breathing and relaxation techniques can help lower stress levels, reduce muscle tension, and relieve the symptoms of silent reflux. It's important to find the techniques that best suit your individual needs and preferences and incorporate them into your daily routine on a regular basis to promote long-term health improvements. Physiotherapy and exercise therapy. Physical therapy and exercise therapy can be important components in the treatment of silent reflux, as they can help improve gastrointestinal function, strengthen muscles, reduce abdominal pressure, and relieve symptoms. Here are some ways physical therapy and exercise therapy can be used in the treatment of silent reflux. Breathing and movement exercises. A physical therapist can guide specific breathing and movement exercises that help strengthen the muscles of the gastrointestinal tract and promote digestion. These include abdominal breathing techniques, targeted stretches for the abdominal muscles, and gentle movements that reduce abdominal pressure. Manual therapy. Through targeted manual techniques, a physical therapist can help release tension and adhesions in the abdominal and chest area that can affect the gastrointestinal tract. This can help relieve stomach congestion and reduce acid reflux. Posture correction. Poor posture, especially hunched over posture, can increase abdominal pressure and worsen reflux. A physical therapist can help improve correct posture and strengthen muscles to reduce abdominal pressure. Whole body exercise therapy. Regular physical activity can help regulate metabolism, control body weight, and reduce stress, all of which can help relieve the symptoms of silent reflux. A physical therapist can help develop an individualized exercise plan that addresses the patient's needs and limitations. Relaxation exercises. In addition to physical exercises, a physical therapist can also guide relaxation exercises such as progressive muscle relaxation, yoga, or Tai Chi to reduce stress and relax the body. This can help reduce abdominal pressure and relieve the symptoms of silent reflux. Biofeedback therapy. In this therapy method, the patient learns how to control the activity of specific muscles through feedback about bodily processes. This can help regulate muscle tone in the gastrointestinal tract and relieve the symptoms of silent reflux. By integrating physical therapy and exercise therapy into the treatment plan, individuals with silent reflux can receive comprehensive and effective therapy aimed at strengthening the gastrointestinal tract, reducing stress, and improving quality of life. It is important to work with a qualified physical therapist to develop an individualized treatment plan that meets the patient's needs and goals. Alternative treatment approaches. Alternative treatment approaches can be a valuable complement or alternative to conventional therapies for silent reflux. Here are some alternative treatment approaches that can help relieve symptoms and improve quality of life. Acupuncture. This traditional Chinese therapy involves inserting fine needles into specific points on the body to regulate energy flow and improve physical and emotional health. Acupuncture can help balance the gastrointestinal tract, improve gastric motility, and reduce reflux. Homeopathy. Homeopathic remedies are made from natural substances and can help relieve the symptoms of silent reflux. For example, remedies such as nux vomica can help with acid reflux and heartburn, while carbo vegetabilis can help with flatulence and a feeling of fullness. However, the correct choice and dosage of homeopathic remedies should always be discussed with an experienced homeopath. Herbal medicine. Various herbs can soothe the gastrointestinal tract and help relieve the symptoms of silent reflux. Herbs commonly used in the treatment of reflux include aloe vera, chamomile, ginger, and licorice root. These can be taken in the form of teas, supplements, or essential oils. Probiotics. Probiotics are beneficial bacteria that can support the gut flora and strengthen the immune system. A healthy gut flora can help reduce inflammation in the gastrointestinal tract and relieve reflux. Probiotics can be taken in the form of supplements specifically formulated for the gastrointestinal tract. Relaxation techniques. Relaxation exercises such as meditation, yoga, Tai Chi, and progressive muscle relaxation can help reduce stress, reduce muscle tension, and relieve the symptoms of silent reflux. Regular relaxation practices can bring the body into a state of calm and balance, which can have a positive effect on the gastrointestinal tract. Chiropractic. Chiropractic treatments can help improve spinal alignment and relieve tension in the back and neck that can affect the gastrointestinal tract. Improved spinal alignment can optimize digestive tract function and reduce reflux. Before pursuing alternative treatment approaches, it is important to consult with a qualified healthcare provider to make an informed decision and consider potential risks and interactions with other therapies. a holistic approach that combines conventional and alternative treatment approaches can often achieve the best results in treating silent reflux. Case studies of successful treatments. Case study 1. Sarah, 38 years old, had been suffering from a chronic cough, hoarseness, and a constant lump in her throat for several years. After several visits to different doctors and tests, she was diagnosed with silent reflux. She opted for a holistic treatment approach that included nutritional optimization, lifestyle changes, and alternative therapies. Under the guidance of a nutritionist, she began avoiding acidic foods and focusing on high-fiber foods. She also learned relaxation techniques such as meditation and progressive muscle relaxation to reduce her stress levels. She also took probiotic supplements and began regular exercise such as yoga and outdoor walks. Within several weeks, Sarah noticed a significant improvement in her symptoms. Her cough became less frequent, her voice clearer, and the lump in her throat almost completely disappeared. She felt more energetic and was finally able to live without discomfort again. Case study 2. Michael, 45 years old, had suffered from heartburn, acid reflux, and occasional hiccups for years. Despite taking medications such as proton pump inhibitors, PPIs, his symptoms were not completely controlled. After a comprehensive discussion with his doctor, Michael opted for a combination of conventional and alternative therapies. He began adjusting his diet by avoiding acidic and fatty foods. He also took homeopathic remedies on the recommendation of his homeopath and began regular acupuncture sessions. He also began targeted exercise therapy under the guidance of a physiotherapist, aimed at strengthening his abdominal muscles and improving his posture. Within a few months, Michael reported a significant reduction in his reflux symptoms. His heartburn became less frequent, acid reflux rarely occurred, and his hiccups disappeared completely. He felt better overall and was grateful for the holistic treatment that had helped him improve his quality of life. These case studies illustrate how comprehensive and individualized treatment, combining conventional and alternative therapeutic approaches, can help relieve the symptoms of silent reflux and help sufferers live a symptom-free life. It is important that each treatment plan is tailored to the patient's individual needs and circumstances to achieve the best results. Tips for a pain-free life. Here are some tips for a symptom-free life with silent reflux. Nutritional optimization. Avoid acidic foods and beverages such as citrus fruits, tomato products, carbonated drinks, coffee, and spicy spices. Instead, consume fiber-rich foods, fruits, vegetables, and lean protein. Small meals. Eat smaller meals throughout the day to reduce pressure in the stomach and minimize the reflux of stomach acid. Avoiding meals before bedtime. Avoid eating large meals at least 2 to 3 hours before bedtime to ease digestion and minimize reflux while sleeping. Weight control. Being overweight can increase abdominal pressure and worsen reflux. Try to maintain a healthy weight or lose weight if necessary. Quit smoking. Smoking weakens the lower esophageal sphincter and increases stomach acid production, which can worsen reflux. Try quitting smoking to relieve your symptoms. Stress management. Stress can worsen reflux. Learn relaxation techniques such as meditation, progressive muscle relaxation, or yoga to reduce stress and relieve your symptoms. Posture. Maintain good posture, especially when sitting and standing. An upright posture can reduce abdominal pressure and minimize reflux. Exercise and physical activity. Regular exercise can help regulate metabolism, control body weight, and reduce stress, all of which can help relieve the symptoms of silent reflux. Sleep hygiene. Sleep with your upper body elevated by placing an extra pillow under your upper back. This can help minimize stomach acid reflux while sleeping. Consult your doctor regularly. Stay under regular medical care and discuss any changes in your symptoms or treatment approaches with your doctor. A doctor can help you adjust your treatment plan to achieve the best possible results. By following these tips and adjusting your lifestyle, you can help relieve the symptoms of silent reflux and live a symptom-free life. It's important to take a holistic approach to treating silent reflux based on your individual needs and circumstances. Self-help strategies in everyday life. Here are some self-help strategies you can use in your daily life to relieve the symptoms of silent reflux and live a symptom-free life. Keep a food diary. Keep a diary of your eating habits and symptoms. This can help you identify potential triggers for your silent reflux and avoid certain foods or beverages that worsen your symptoms. Small meals. Eating smaller portions at mealtimes and avoiding eating too much at once can reduce pressure in the stomach and minimize reflux. Eat calmly. Take your time with your meals and chew thoroughly. Eat in a relaxed environment without rushing or talking too much while eating to aid digestion and reduce reflux. Upright posture while eating. Sit upright during meals and avoid lying down immediately after eating. An upright posture can help reduce pressure in the stomach and minimize acid reflux. Weight control. If you are overweight, reducing your body weight can help reduce abdominal pressure and relieve the symptoms of silent reflux. Stress management. Learn relaxation techniques such as meditation, breathing exercises, or progressive muscle relaxation to reduce stress and relieve the symptoms of silent reflux. Healthy lifestyle. Live a healthy lifestyle by incorporating regular exercise into your daily routine, getting enough sleep, and avoiding alcohol and nicotine. A healthy lifestyle can help reduce the symptoms of silent reflux and improve your overall health. Monitor your sleep position. Sleep with your upper body elevated by placing an extra pillow under your upper back. This can help minimize stomach acid reflux while sleeping. Pay attention to trigger factors. Identify personal trigger factors such as certain foods, stressful situations or certain positions that worsen your symptoms and avoid them as much as possible. Regular medical care. Stay under regular medical care and discuss any changes in your symptoms or treatment approaches with your doctor. A doctor can help you adjust your treatment plan to achieve the best possible results. By incorporating these self-care strategies into your daily routine, you can help relieve the symptoms of silent reflux and live a symptom-free life. It's important to take a holistic approach to treating silent reflux based on your individual needs and seek professional help if needed. Dealing with setbacks and challenges. Dealing with setbacks and challenges with silent reflux can be emotionally draining, but there are strategies to cope and continue to make positive changes. Acceptance. Accept that setbacks are part of the recovery process. It's important to understand that the path to recovery isn't always linear and sometimes involves ups and downs. Self-care. Take time for yourself and practice self-care. Do things that bring you joy and relaxation, such as walking in nature, reading, or meeting with friends. Positive self-talk. Encourage yourself and reassure yourself. Remind yourself that you've already made progress and that you're capable of overcoming these challenges. Flexibility. Be flexible and adapt your treatment strategies as needed. If a particular therapy method doesn't produce the desired results, you can discuss and try other options with your doctor. Seek support. Seek support from friends, family, or support groups. Talking to other people affected can be helpful and help you feel like you're not alone in facing your challenges. Professional help. Don't hesitate to seek professional help if you feel like you can't cope on your own. A therapist or counselor can help you manage your emotions and provide coping strategies. Patience. Be patient with yourself and the healing process. It may take time for changes to appear, and it's important not to despair if there aren't immediate results. Change your perspective. Try to view challenges as opportunities for personal growth. Every setback can be an opportunity to learn and develop new coping skills. Focus on the positive. Focus on the positive aspects of your life and your health. Keep a gratitude journal or become aware of what you are grateful for to boost your mood. Believe in your abilities. Trust that you have the skills and resources to overcome difficult times. Believe in yourself and that you can emerge stronger from these challenges. By applying these strategies and actively addressing setbacks and challenges, you can develop a positive and constructive approach to your silent reflux and continue on the path to better health. Exercises for the diaphragm. The diaphragm is an important muscle that plays a key role in breathing and regulating abdominal pressure. Here are some exercises aimed at strengthening the diaphragm and improving its function. Diaphragmatic breathing. Sit or lie down in a comfortable position. Place one hand on your abdomen and the other on your chest. Inhale deeply through your nose, feeling your abdomen expand outward while your chest moves only minimally. Hold your breath briefly, then exhale slowly through your mouth while gently contracting your abdominal muscles. Repeat this several times to activate and strengthen the diaphragm. Diaphragm stretch. Sit upright and place your hands on your thighs. Inhale deeply and simultaneously raise your arms above your head. Hold this position for a few seconds, feeling the stretch in your diaphragm and abdomen. Then exhale slowly and lower your arms back to your thighs. Repeat this exercise several times to improve diaphragmatic flexibility. Diaphragm contraction. Lie on your back and bend your knees so your feet are flat on the floor. Place one hand on your chest and the other hand on your abdomen. Inhale deeply and simultaneously draw your abdominal muscles in and up to contract your diaphragm. Hold this position for a few seconds. Then relax your abdominal muscles as you exhale. Repeat this exercise several times to strengthen your diaphragm. Resisted breathing exercises. Use a breathing device or breathing ball to perform resisted breathing exercises. Breathe deeply through your nose and feel your diaphragm move downward as you breathe against the resistance. Hold your breath briefly and then exhale slowly through your mouth. These exercises can help improve diaphragmatic strength and endurance. Yoga and Pilates exercises. Many yoga and Pilates exercises aim to strengthen and stretch the diaphragm. Exercises like the yoga bridge or downward dog can help activate and strengthen the diaphragm. It's important to perform these exercises slowly and with control, listening to your body. Start with a moderate intensity and increase over time as needed. If you have any questions or health concerns, please consult a qualified physical therapist or trainer before beginning any new exercises. Exercises for proper breathing. Proper breathing is crucial for health and well-being, as it increases oxygen levels in the body, reduces stress, and improves diaphragm function. Here are some exercises that can help you learn and practice proper breathing. Diaphragmatic breathing. Sit or lie down in a comfortable position. Place one hand on your abdomen and the other on your chest. Inhale deeply through your nose, feeling your abdomen expand outward while your chest moves only minimally. Hold your breath briefly, then exhale slowly through your mouth while gently contracting your abdominal muscles. Repeat this exercise several times to activate the diaphragm and promote proper breathing. 4, 7, 8 breathing. Inhale through your nose and count to 4. Hold your breath and count to 7. Then exhale slowly through your mouth and count to 8. This technique can help reduce stress and calm the mind. Breath focusing. Sit in a comfortable position and focus on your breathing. Notice how your belly rises and falls as you inhale and exhale. Try to quiet your thoughts and focus only on the rhythm of your breath. This exercise can help center your mind and reduce stress. Progressive muscle relaxation. Relax in a comfortable position and focus on individual muscle groups in your body, starting with your feet and slowly working your way up. Tense each muscle for a few seconds and then release the tension while breathing deeply. This exercise can help release physical tension and deepen breathing. Yoga and Tai Chi breathing. Practice breathing techniques from yoga or Tai Chi that promote mind-body connection and deepen your breathing. Listen for breathing guidance during the exercises and focus on synchronizing your breath with your movements. Daily breathing exercises. Try incorporating conscious breathing into your daily routine by taking regular short breaks or consciously taking deep breaths when you're stressed or tense. These short breathing breaks can help calm your mind and renew your energy. By practicing these breathing exercises regularly, you can improve your breathing, reduce stress, and promote your overall health and well-being. It's important to perform these exercises slowly and with control, listening to your body. If you have any health concerns, please consult a qualified therapist or doctor before beginning any new exercises. How do I protect my esophagus? Protecting your esophagus from damage caused by silent reflux and other factors is crucial to maintaining your health. Here are some important steps you can take to protect your esophagus. Avoid trigger foods. Identify foods and beverages that worsen your symptoms and avoid them as much as possible. Acidic foods, spicy foods, fatty foods, caffeinated beverages, and alcohol can worsen reflux and irritate the esophagus. Eat small meals. Eat smaller portions at mealtimes and avoid large meals, which can put a lot of strain on the stomach and increase reflux. Avoid eating before bedtime. Avoid eating large meals at least 2 to 3 hours before bedtime to ease digestion and minimize reflux while sleeping. Drink plenty of water. Stay hydrated by drinking plenty of water. This can help aid digestion and thin stomach contents, which can reduce reflux. Avoid smoking. Nicotine can weaken the esophageal sphincter and increase reflux. Try reducing or quitting smoking to protect your esophagus. Limit alcohol consumption. Alcohol can increase stomach acid production and irritate the lining of the esophagus. Reduce or eliminate alcohol consumption to protect your esophagus. Avoid tight clothing. Tight-fitting clothing, especially around the abdominal area, can increase pressure on the stomach and worsen reflux. Wear loose clothing to avoid putting additional pressure on the stomach. Avoid prolonged bending or lifting. Avoid prolonged bending or lifting heavy objects, as this can increase abdominal pressure and worsen reflux. Upright posture. Maintain an upright posture when sitting and standing to reduce pressure on the stomach and minimize the reflux of stomach acid. Exercise and sport. Regular exercise and physical activity can support digestion and help maintain a healthy weight, which can reduce reflux. By implementing these measures, you can help protect your esophagus from damage caused by silent reflux and other factors, as well as promote your overall health. It's important to implement these recommendations in consultation with your doctor and tailor them to your specific needs and health condition. Which foods are harmful? Certain foods can aggravate silent reflux and worsen symptoms like heartburn, acid reflux, and esophageal irritation. Here are some of the most common harmful foods to avoid. Acidic foods. Citrus fruits such as oranges, grapefruits, lemons and limes, as well as acidic foods such as tomatoes and tomato products, can increase reflux and irritate the lining of the esophagus. Hot spices and sauces. Foods containing hot spices, such as chili, cayenne pepper, hot sauces and spicy curries, can worsen reflux and increase symptoms. High-fat foods. High-fat foods such as fried foods, fatty meats, fatty sauces, and fast food can burden the stomach and increase reflux. Caffeinated drinks. Coffee, black tea, energy drinks, and caffeinated soft drinks can increase stomach acid production and worsen reflux. Alcohol. Alcohol can irritate the lining of the esophagus and increase the production of stomach acid, which can worsen reflux. Chocolate. Chocolate contains caffeine and may interfere with the relaxation of the lower esophageal sphincter, which may promote the reflux of stomach acid. Onions and garlic. Onions and garlic contain sulfur-containing compounds that can increase reflux and cause discomfort in some people. Mint and peppermint. Mint can interfere with the relaxation of the lower esophageal sphincter and worsen reflux. This also applies to peppermint tea and other peppermint-flavored products. Carbonated drinks. Carbonated drinks such as soda, sparkling water, and other carbonated drinks can increase reflux and cause bloating. Dairy products. Some people are sensitive to dairy products, especially whole milk and cheese, which can lead to an increase in reflux. Choosing low-fat or lactose-free options may be helpful. It's important to note that reactions to certain foods can vary from person to person. Keeping a food diary can help you determine which foods worsen your symptoms and then avoid them. If symptoms are severe or persistent, it's advisable to consult a doctor for appropriate treatment. Which medications am I most often prescribed? For silent reflux, various medications can be prescribed to relieve symptoms and treat the reflux. The choice of medication depends on the severity of the symptoms, the course of the disease, and the individual needs of the patient. Here are some of the most common medications prescribed to treat silent reflux. Proton pump inhibitors, PPIs. PPIs such as omeprazole, pantoprazole, esomeprazole, and lansoprazole are commonly used to treat silent reflux symptoms. These medications reduce stomach acid production and help relieve heartburn, acid reflux, and other reflux symptoms. H2 blockers. H2 blockers such as ranitidine, famotidine, and cimetidine can also be used to reduce stomach acid production. They may be effective in some patients, especially when PPIs are not sufficiently effective or are not tolerated. Antacids. Antacids such as Marlux, Mylanta, Rani, and Tums can be used for fast relief of heartburn and acid reflux. These medications neutralize stomach acid and provide temporary relief from symptoms. Prokinetics. Prokinetics such as metoclopramide may be prescribed to improve gastrointestinal motility and empty the stomach more quickly. This can help reduce stomach acid reflux and relieve the symptoms of silent reflux. Mucosal protectants. Mucosal protectants such as sucralfate may be prescribed to protect the lining of the esophagus and reduce inflammation. Probiotics. Probiotics can be used to support gut health and reduce stomach upset. They can help restore the balance of gut flora and improve the symptoms of silent reflux. It's important to note that medication selection should be individualized and made by a physician, taking into account the clinical picture, severity of symptoms, medical history, and other factors. Medication use should always be under medical supervision to minimize side effects and ensure the best possible treatment. Which Schussler salts can help me? Schussler salts are often used as an alternative treatment for various conditions, including digestive disorders such as silent reflux. It's important to note that the use of Schussler salts is not supported by all physicians, and there is no scientific evidence supporting their effectiveness in treating silent reflux. Nevertheless, some people may experience subjective improvements in their symptoms. Here are some Schussler salts that may be recommended for the relief of silent reflux symptoms. Schussler salt No. 7. Magnesium phosphoricum. This salt is often used to relax muscles and relieve cramps. It can be helpful in relaxing the muscles of the digestive tract and relieving the symptoms of silent reflux. Schussler salt No. 10. Natrium sulfuricum. This salt is traditionally used to support liver and gallbladder function and to detoxify the body. It can be helpful in supporting digestion and promoting the elimination of toxins. Schussler salt No. 11. Silicone. Silica is often used to strengthen connective tissue and promote regeneration. It can help strengthen the esophageal mucosa and reduce inflammation. Schussler salt No. 6. Kalium sulfuricum. This salt is often used to support liver function and detoxification. It can be helpful in promoting digestion and relieving the symptoms of silent reflux. Schussler salt No. 9. Natrium phosphoricum. This salt is traditionally used to regulate acid-base balance and neutralize excess stomach acid. It can help neutralize excess stomach acid and relieve the symptoms of silent reflux. It's important to emphasize that the use of Schussler salts for silent reflux symptoms should be individualized and not a substitute for medical treatment. It's advisable to consult a qualified physician or therapist before using Schussler salts or other alternative treatment methods to ensure they are suitable for your specific situation and will not cause adverse effects. Which Bach flowers support me? Bach flower remedies are often used to relieve the emotional discomfort and stress that can often accompany health problems like silent reflux. While Bach flower remedies don't directly treat physical symptoms, they can help reduce emotional distress and improve overall well-being. Here are some Bach flower remedies that may be helpful for silent reflux. Agrimony. This remedy is used to support people who hide their inner conflicts behind a cheerful and carefree exterior. It can help those suffering from silent reflux and suppressing their feelings instead of expressing them. Cherry plum. This flower is used to support people who feel anxious or distressed and fear losing control. People with silent reflux may benefit from this remedy when they feel stressed or anxious because they are losing control of their health. Rock water. This remedy is often recommended for people who are too strict with themselves and their lifestyle. It can be useful for silent reflux patients who tend to criticize themselves or impose overly strict rules on their diet or lifestyle. Vervain. This flower is used to support people who feel overly committed and have difficulty relaxing. Those with silent reflux symptoms who tend to feel stressed and overwhelmed may benefit from vervain to achieve greater serenity. Walnut. Walnut is often recommended as a transitional remedy, helping people adapt to changes and ward off external influences. Individuals with silent reflux symptoms who have difficulty adjusting to new dietary habits or stressors may benefit from it. Rescue remedy. Emergency drops. This is a mixture of several Bach flower remedies and is often used to help with acute stress or emotional distress. People with silent reflux can benefit from rescue remedy to manage acute stress reactions and regulate their emotions in difficult situations. It's important to emphasize that Bach flower remedies are a complementary form of therapy and should not be used as a substitute for medical treatment. If you're considering Bach flower remedies, it's advisable to consult with an experienced Bach flower therapist or qualified healthcare provider to identify the most suitable flowers for your individual needs and determine the correct dosage and application. Glossary. Silent reflux. A form of gastroesophageal reflux, GERD, in which stomach acid and other stomach contents flow back into the esophagus but do not cause typical symptoms such as heartburn, acid reflux, or vomiting. Instead, symptoms such as coughing, clearing of the throat, hoarseness, sore throat, and other non-specific complaints may occur. Gastroesophageal reflux, GERD, a condition in which stomach acid regularly flows back into the esophagus and can cause symptoms such as heartburn, acid reflux, chest pain, and inflammation of the esophagus. Esophageal sphincter, a circular muscle at the lower end of the esophagus that normally remains closed to prevent stomach acid and digestive secretions from flowing back into the esophagus. Dysfunction of this sphincter can lead to GERD and silent reflux symptoms. Diaphragm, a large, muscular septum that separates the chest cavity from the abdominal cavity. The diaphragm is important for breathing and plays a role in regulating abdominal pressure. Proton pump inhibitors, PPIs, a class of medications used to reduce stomach acid production. PPIs are often prescribed to treat GERD and silent reflux symptoms. H2 blockers, another class of medications used to reduce stomach acid production. H2 blockers inhibit the action of histamine, a hormone that stimulates acid production in the stomach. Endoscopy, a diagnostic procedure in which a flexible tube with a camera endoscope is inserted through the mouth into the esophagus to check the condition of the esophagus and stomach. Endoscopy is often performed in patients with GERD to identify inflammation or damage in the esophagus. pH metry, a diagnostic procedure in which a thin tube, probe, is inserted into the esophagus to measure the pH, acidity, in the esophagus over a period of time. pH metry is used to diagnose GERD and silent reflux and to determine the severity of reflux disease. Dietary changes, a change in eating habits aimed at avoiding trigger foods and promoting a healthier diet. Dietary changes can help relieve the symptoms of GERD and silent reflux. Breathing techniques, specific breathing exercises aimed at regulating breathing, reducing stress, and relieving the symptoms of GERD and silent reflux. Introduction to healthy eating. Inflammation is a natural part of the body's defense system and plays an important role in healing injuries and infections. However, chronic inflammation that persists over a long period of time can lead to a variety of health problems. Chronic inflammation is linked to diseases such as heart disease, diabetes, arthritis, cancer, and many others. The good news is that we can influence inflammation through our diet. A heartburn-relieving diet aims to choose foods that can reduce inflammation in the body and lower the risk of chronic disease. This diet is based on abundant consumption of fruits, vegetables, whole grains, healthy fats, and heartburn-relieving spices. In this book, we'll explore the basics of a heartburn-relieving diet and learn how it can help us improve our health. We'll take a closer look at the effects of inflammation on the body and understand why targeted dietary changes are so important. In the first chapter, we'll explore the basics of a heartburn-relieving diet. We'll explore the concept of inflammation and understand how it arises in the body. We'll also learn why diet plays a crucial role in regulating inflammation and how certain foods can be pro-inflammatory. In the second chapter, we'll take a closer look at foods that promote inflammation. Sugar, trans fats, and processed foods are examples of foods that can promote inflammatory reactions in the body. We'll understand why it's important to reduce or avoid these foods to combat inflammation and improve our health. The third chapter focuses on foods that relieve heartburn. We'll learn which foods are particularly rich in heartburn-relieving properties and why they are so beneficial to our health. Antioxidants and omega-3 fatty acids are just some of the ingredients found in these foods that can reduce inflammation in the body. In the fourth chapter, we will receive practical tips for implementing a heartburn-relieving diet in everyday life. Why a heartburn-relieving diet is important. A heartburn-relieving diet is important for our health for several reasons. Chronic inflammation in the body is linked to a variety of diseases and health problems, including heart disease, diabetes, arthritis, Alzheimer's disease, cancer, and many more. By following a heartburn-relieving diet, we can help reduce inflammation in the body and lower the risk of these diseases. Here are some reasons why a heartburn-relieving diet is important. Reducing inflammation. A heartburn-relieving diet focuses on choosing foods that can reduce pro-inflammatory processes in the body. By incorporating heartburn-relieving foods such as fruits, vegetables, healthy fats, and spices into our diet, we can better control inflammation in the body. Prevention of chronic diseases. Chronic inflammation is linked to many serious diseases. By reducing inflammation, we can reduce the risk of heart disease, diabetes, certain cancers, Alzheimer's disease, and other conditions. A heartburn-relieving diet can therefore serve as a preventative measure. Immune system support. Inflammation is a natural response of the immune system to injury or infection. However, excessive or chronic inflammation can strain the immune system. A heartburn-relieving diet rich in nutrients and antioxidants can strengthen the immune system and support the body's defenses. Improved digestion. Inflammation in the intestinal tract can lead to problems such as irritable bowel syndrome, inflammatory bowel disease, and other digestive disorders. By following a heartburn-relieving diet that includes fiber-rich foods and probiotics, we can promote gut health and reduce digestive discomfort. Promotes overall health and well-being. A heartburn-relieving diet based on nutrient-dense foods provides the body with essential vitamins, minerals, antioxidants, and healthy fats. This can lead to increased energy, a better mood, healthier skin, a strengthened immune system, and an overall improved sense of well-being. It is important to note that a heartburn-relieving diet should be part of a healthy lifestyle that includes regular physical activity, adequate sleep, stress management, and avoiding harmful habits. The effects of inflammation on health. Inflammation is the body's natural response to damage or infection. In such cases, a short-term inflammatory response is important to protect the affected tissue and initiate the healing process. However, chronic inflammation that persists over a longer period of time can have significant health consequences. Here are some of the potential effects of chronic inflammation. Heart disease. Chronic inflammation is considered a major factor in the development of heart disease. Inflammation can lead to damage to blood vessels, which promotes the formation of plaques. These plaques can narrow blood vessels and lead to atherosclerotic changes, increasing the risk of heart attacks and strokes. Diabetes. Inflammation can also increase insulin resistance, which can lead to type 2 diabetes. Chronic inflammation can impair insulin production and function, leading to elevated blood sugar levels and impaired glucose regulation in the body. Autoimmune diseases. In autoimmune diseases, the immune system mistakenly attacks the body's own tissues, leading to inflammation. Diseases such as rheumatoid arthritis, lupus, inflammatory bowel disease, and psoriasis are examples of autoimmune diseases in which chronic inflammation plays a crucial role. Cancer. Chronic inflammation can increase the risk of cancer by promoting cell division and tumor growth. Inflammation can cause genetic changes in cells and promote the development of cancer cells. Neurodegenerative diseases. There is a link between chronic inflammation and neurodegenerative diseases such as Alzheimer's, Parkinson's, and multiple sclerosis. Inflammatory processes in the brain can lead to nerve cell damage and accelerate the progression of these diseases. Obesity and metabolic disorders. Chronic inflammation can affect metabolism and contribute to weight gain and fat accumulation. Inflammation can also disrupt hormone regulation and promote the development of insulin resistance and metabolic syndrome. It's important to note that chronic inflammation isn't solely a result of diet. It can also be influenced by other factors such as stress, environmental toxins, smoking, and physical inactivity. A healthy lifestyle, including a heartburn-relieving diet, regular physical activity, and stress management, can help reduce inflammation. What are inflammations of the esophagus and body? Inflammation in the body is a fascinating yet complex topic. It is an integral part of our immune system and plays a crucial role in fighting off pathogens and repairing tissue damage. But like every story, the story of inflammation also has its dark sides, where it can become the body's enemy. Inflammation is essentially the body's response to damage or threat. This process is deeply rooted in evolution and serves to protect the body from harmful influences. It begins when the immune system detects that something is wrong. This could be an infection by bacteria, viruses, or other pathogens, but also injury, irritation, or even chronic stress. The first phase of inflammation is called acute inflammation. It occurs rapidly and is usually accompanied by visible symptoms such as swelling, redness, pain, and fever. These are all signs that the immune system is active and trying to fight the threat. The key players in this phase are white blood cells, particularly neutrophils and macrophages. These cells are the foot soldiers of the immune system and pounce on the invaders to destroy them, releasing pro-inflammatory substances that help contain the infection. Once the acute phase is successfully resolved, the body should return to normal. This occurs through the resolution of inflammation, which activates mechanisms that relieve heartburn. This is where other types of white blood cells, such as T lymphocytes and B lymphocytes, come into play. They regulate inflammation and promote healing. This all sounds very good and necessary, but what happens when the inflammation gets out of control or becomes chronic? This is where chronic inflammation comes in. It's like a long-lasting, bad chapter in the body's history. While acute inflammation usually serves to protect and heal the body, chronic inflammation can actually be harmful. Chronic inflammation can be triggered by various factors, including smoking, poor diet, lack of exercise, and chronic stress. In some cases, the immune system can also attack the body, triggering an autoimmune reaction. This causes the body to remain permanently in a state of inflammation. The effects of chronic inflammation can be severe. It's been linked to a wide range of diseases, including heart disease, diabetes, cancer, Alzheimer's disease, and even depression. In this respect, the story of inflammation is one of health challenges and risks. However, there is hope and ways to combat chronic inflammation. A healthy lifestyle that includes a balanced diet, regular exercise, and stress management can help reduce inflammation. In addition, there are medications and therapies that specifically target chronic inflammation. The story of inflammation in the body, then, includes both heroes and villains. Inflammation is the body's natural response to threats, protecting and healing us. But when it gets out of control, it can lead to serious health problems. It's up to us to understand this story and take steps to ensure inflammation doesn't take over our bodies. Injuries in the body. Inflammation is a complex response of the body to injury, infection, or tissue damage. It is part of the natural healing process and serves to protect the body from damage and promote tissue repair. Inflammation can occur in various tissues and organs of the body and is controlled by a range of biochemical and cellular processes. Types of inflammation. There are two types of inflammation: acute and chronic inflammation. Acute inflammation. They occur as an immediate response to damage or infection and are usually short-lived. They are characterized by characteristic symptoms such as redness, swelling, heat, pain, and loss of function in the affected area. Acute inflammation is controlled by immune cells such as neutrophils and macrophages, which fight off infectious agents, repair tissue damage, and support the healing process. Chronic inflammation. In contrast, chronic inflammation is a long-lasting inflammatory response that can last for weeks, months, or even years. It is caused by persistent irritants or immunological dysregulation. Chronic inflammation can be nonspecific and occur in various tissues or organs. Unlike acute inflammation, it can be harmful and damage surrounding tissue. Chronic inflammation is associated with a variety of diseases, including cardiovascular disease, diabetes, rheumatoid arthritis, inflammatory bowel disease, and cancer. Inflammation is controlled by complex cellular and molecular processes. When tissue is damaged or an infection occurs, immune cells and tissue cells release They release messenger substances called inflammatory mediators. These mediators include cytokines, chemokines, prostaglandins, and leukotrienes. These messenger substances attract additional immune cells to the site of inflammation and amplify the inflammatory response. The inflammatory mediators increase the permeability of blood vessels to allow the immigration of immune cells and activate the immune cells to fight harmful substances. While inflammation plays an important role in fighting off infections and healing injuries, chronic inflammation can be harmful. It can lead to excessive tissue damage, loss of function, and the development of disease. Therefore, it's important to maintain a healthy lifestyle that reduces inflammation. This includes a heartburn-relieving diet, regular physical activity, and adequate sleep. The role of nutrition in fighting inflammation. Diet plays a significant role in fighting inflammation. Certain foods can have pro-inflammatory or heartburn-relieving properties, thus influencing the inflammatory responses in the body. A heartburn-relieving diet can help reduce inflammation and lower the risk of chronic diseases. Here are some key aspects of diet related to fighting inflammation. Antioxidants. Antioxidants are compounds that can protect the body from harmful free radicals that contribute to inflammation and cell damage. Foods such as berries, leafy green vegetables, nuts, seeds, and spices like turmeric are rich in antioxidants and should be included in a heartburn-relieving diet. Omega-3 fatty acids. Omega-3 fatty acids have heartburn-relieving properties and can help maintain the balance between pro-inflammatory and heartburn-relieving processes in the body. Foods such as fatty fish, salmon, mackerel, sardines, flaxseed, chia seeds, and walnuts are good sources of omega-3 fatty acids. Healthy fats. Healthy fats like olive oil, avocado, nuts, and seeds contain compounds that relieve heartburn and can help reduce inflammation in the body. It's important to consume healthy fats in moderation, as they are still high in calories. Whole grain products and fiber. Whole grain products and fiber-rich foods such as whole grains, legumes, vegetables, and fruits are important for a diet that relieves heartburn. Fiber promotes healthy gut flora and can reduce inflammation in the gut. Avoiding pro-inflammatory foods. Certain foods can contain pro-inflammatory substances, such as saturated and trans fats, refined sugar, processed foods, and excessive alcohol consumption. It's advisable to reduce or avoid these foods to control inflammation in the body. Individualize your diet. It's important to note that the body's response to certain foods can vary from person to person. Some people may be sensitive to certain foods and trigger inflammation. Therefore, individualized dietary adjustments may be necessary to identify and avoid potential triggers. The most important principles of a heartburn-relieving diet. The main principles of a heartburn-relieving diet include plenty of fruits and vegetables. Fruits and vegetables are rich in antioxidants, fiber, vitamins, and minerals that have heartburn-relieving properties. Try to include a variety of fruits and vegetables in your diet and favor brightly colored varieties, as different colors can relieve heartburn in different ways. Healthy fats. Healthy fats like omega-3 fatty acids have heartburn-relieving properties. They are found in fatty fish, salmon, mackerel, sardines, flax seeds, chia seeds, walnuts, avocados, and olive oil. Replace unhealthy fats like saturated and trans fats with these healthy fat sources. Whole grains. Whole grains contain fiber and phytonutrients that can reduce inflammation. Choose whole grain bread, whole wheat pasta, brown rice, and oatmeal instead of refined grains. Legumes. Legumes such as beans, lentils, and chickpeas are good sources of plant-based protein, fiber, and antioxidants. They can relieve heartburn and should be included regularly in your diet. Nuts and seeds. Nuts and seeds contain healthy fats, fiber, antioxidants, and heartburn-relieving compounds. Walnuts, flax seeds, chia seeds, almonds, and cashews are good options for fighting inflammation. Spices and herbs. Spices and herbs such as turmeric, ginger, garlic, cinnamon, and oregano have powerful heartburn-relieving properties. Add these spices and herbs to your meals to enhance the heartburn-relieving effect of your diet. Avoid inflammatory foods. Reduce your consumption of processed foods, sugary drinks, refined carbohydrates, saturated and trans fats, and excessive alcohol. These foods can promote inflammation and should therefore be consumed in moderation or not at all. Adequate hydration. Drink plenty of water to keep your body hydrated and help eliminate toxins. It's important to note that a heartburn-relieving diet is part of a healthy lifestyle and cannot guarantee a cure or prevention of disease on its own. It's advisable to take a holistic approach. Inflammatory foods. In this chapter, we'll look at pro-inflammatory foods that can increase inflammation in the body. While it's important to focus on foods that relieve heartburn, it's also important to know which foods to avoid or limit to avoid a pro-inflammatory diet. Here are some examples of pro-inflammatory foods. Saturated fats. Foods rich in saturated fats can promote inflammation. These fatty acids are found primarily in animal products such as red meat, butter, cheese, and whole milk. It is recommended to reduce saturated fat consumption and switch to healthier sources of fat. Trans fats. Trans fatty acids are artificially produced fats found in many processed foods such as fried snacks, baked goods, margarine, and many fast food products. Trans fats are not only inflammatory but also associated with an increased risk of heart disease. It's advisable to avoid trans fats as much as possible. Refined sugar. Excessive consumption of refined sugar and sugary foods can lead to increased blood sugar levels and promote inflammation in the body. Soft drinks, sweets, pastries, and processed foods often contain large amounts of refined sugar. It's important to reduce sugar consumption and switch to natural sweeteners such as honey, maple syrup, or stevia. Processed foods. Processed foods such as fast food, convenience foods, snacks, and frozen meals often contain high amounts of saturated fat, trans fat, refined sugar, and other pro-inflammatory ingredients. They should be avoided as much as possible, as they not only promote inflammation but are also associated with an increased risk of chronic diseases such as obesity, diabetes, and cardiovascular disease. Grains containing gluten. Gluten is a protein found in wheat, barley, rye, and some other grains. In some people, consuming gluten can lead to inflammatory reactions in the gut. People with a diagnosed gluten intolerance, such as celiac disease, should avoid gluten-containing grain products entirely. For others, it may be beneficial to reduce their consumption of gluten-containing grain products and replace them with alternative grains such as oats, quinoa, or buckwheat. Foods that promote heartburn. Inflammation in the body can be promoted by the consumption of certain foods. Here are some examples of foods that can promote inflammation. Saturated fats. Foods such as red meat, butter, cheese, cream, and high-fat dairy products contain high amounts of saturated fat, which can promote inflammation. Trans fats. Trans fats are artificially hydrogenated fats found in many processed foods such as snacks, baked goods, margarine, and fried foods. They increase the risk of inflammation in the body and should be avoided. Refined sugar. Sugary foods and beverages such as sodas, candy, pastries, and desserts can promote inflammation. High sugar consumption can lead to a rise in blood sugar levels and increased production of pro-inflammatory substances. Processed foods. Processed foods such as fast food, convenience foods, snacks, and frozen meals often contain additives, preservatives, and high amounts of saturated fat, trans fat, and refined sugar, which can promote inflammation in the body. Red meat. Excessive consumption of red meat such as beef, pork, and lamb can be pro-inflammatory. Red meat contains saturated fat and may also contain pro-inflammatory compounds formed during processing or preparation. Processed grains. Processed grain products such as white bread, white flour products, refined pasta, and high sugar cereals have a higher glycemic index and can promote inflammation. Alcohol. Excessive alcohol consumption can lead to inflammation in the body. Alcohol puts a strain on the liver and can lead to damage and inflammation, especially with long-term and excessive consumption. It's important to note that consuming these foods occasionally in moderation isn't usually a problem. However, it's advisable to reduce your consumption of these pro-inflammatory foods and replace them with healthier alternatives to reduce inflammation in the body. The effects of sugar, trans fats and processed foods on inflammation. Sugar, trans fats, and processed foods can have significant effects on inflammation in the body. Here are some of the specific effects these foods have on inflammation. Sugar. High consumption of refined sugar and sugary foods can lead to chronic inflammation. Sugary foods raise blood sugar levels and activate the immune system, which can lead to increased production of inflammatory messengers. In the long term, this can lead to a persistent state of inflammation in the body, which has been linked to various health problems. Trans fats. Trans fats are artificially produced fats created through a process called partial hydrogenation of vegetable oils. These fats are used in many processed foods such as French fries, snacks, baked goods, cookies, and margarine. Trans fats increase the risk of inflammation by raising the levels of inflammatory markers in the blood and impairing blood vessel function. They can also increase the production of pro-inflammatory substances in the body while weakening mechanisms that relieve heartburn. Processed foods. Processed foods often contain high amounts of sugar, trans fats, saturated fats, refined carbohydrates, and additives. These ingredients can increase the risk of inflammation. Furthermore, processed foods can impair gut health. Impaired gut health can lead to increased permeability of the intestinal wall, which in turn can promote inflammation in the body. Inflammation in the body is linked to a variety of health problems, including cardiovascular disease, diabetes, obesity, autoimmune diseases, and even cancer. By avoiding excessive sugar, trans fats, and processed foods and transitioning to a heartburn relieving diet of fresh, unprocessed foods, You can reduce the risk of inflammation in the body and promote better health. The link between an unhealthy diet and chronic diseases. An unhealthy diet plays a significant role in the onset and development of chronic diseases. Here is the connection between an unhealthy diet and various chronic diseases. Cardiovascular disease. A diet rich in saturated fats, trans fats, cholesterol, and sodium can increase the risk of cardiovascular disease. High consumption of processed foods, fast food, fried foods, and saturated fats can lead to high blood pressure, elevated blood lipid levels, hardening of the arteries, atherosclerosis, and ultimately, heart attack or stroke. Type 2 diabetes. An unbalanced diet rich in refined carbohydrates, sugar, and saturated fat can increase the risk of developing type 2 diabetes. Excessive consumption of sugary drinks and processed foods can lead to insulin resistance, in which the body no longer responds effectively to the hormone insulin and regulates blood sugar levels. Obesity. A high-calorie diet rich in sugary foods, saturated fats, and processed foods contributes to the development of obesity. Obesity, in turn, increases the risk of a variety of health problems, including cardiovascular disease, type 2 diabetes, certain cancers, joint problems, and sleep apnea. Cancer. An unhealthy diet, especially one rich in processed foods, red meat, saturated fat, and sugary drinks, can increase the risk of certain cancers, such as colon cancer, breast cancer, prostate cancer, and pancreatic cancer. A diet low in fiber can also increase the risk of colon cancer. Inflammatory diseases. A diet rich in inflammatory foods such as saturated fats, trans fats, and refined carbohydrates can promote chronic inflammation in the body. Chronic inflammation, associated with diseases such as rheumatoid arthritis, inflammatory bowel diseases, Crohn's disease, ulcerative colitis, and autoimmune diseases. It's important to note that an unhealthy diet isn't the only factor leading to chronic diseases. Lifestyle factors such as physical inactivity, smoking, excessive alcohol consumption, and genetic predisposition also play a role. Foods that relieve heartburn. In this chapter, we'll look at heartburn-relieving foods that can help reduce inflammation in the body and promote a healthy diet. Consuming these foods can help fight inflammation and reduce the risk of chronic diseases. Here are some of the top heartburn-relieving foods. Fatty fish. Fatty fish such as salmon, mackerel, sardines, and herring are rich in omega-3 fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These omega-3 fatty acids have heartburn-relieving properties and may help reduce chronic inflammation in the body. Berries. Berries like blueberries, raspberries, strawberries, and blackberries are rich in antioxidants and heartburn-relieving compounds like flavonoids and anthocyanins. These nutrients can reduce inflammation and promote health. Green leafy vegetables. Green leafy vegetables like spinach, kale, chard, and arugula are rich in antioxidants, vitamins, and minerals. They also contain heartburn-relieving compounds like carotenoids and vitamin K, which can help reduce inflammation in the body. Nuts and seeds. Nuts and seeds such as walnuts, flax seeds, chia seeds, and almonds are rich in healthy fats, fiber, and antioxidants. They can reduce inflammation and have a heartburn-relieving effect in the body. Turmeric. Turmeric is a yellow spice plant that contains the heartburn-relieving compound curcumin. Curcumin has powerful antioxidant and heartburn-relieving properties and may help treat inflammatory conditions like arthritis. Ginger. Ginger contains heartburn-relieving compounds such as gingerols and shogaols. It can reduce inflammation and help treat inflammatory diseases. Olive oil. Rich in heartburn-relieving antioxidants and monounsaturated fatty acids. Extra virgin olive oil can help reduce inflammation in the body and lower the risk of chronic diseases. Whole grain products. Whole grain products such as oatmeal, whole wheat bread, and brown rice contain fiber and antioxidants that may have heartburn-relieving properties. Green tea. Green tea is rich in antioxidants such as epigallocatechin gallate, EGCG, which may have heartburn-relieving effects. The best foods to relieve heartburn. The best foods for heartburn relief are those rich in nutrients, antioxidants, and heartburn-relieving compounds. Here are some of the best heartburn-relieving foods to include in your diet. Fatty fish, salmon, mackerel, sardines and herring are rich in omega-3 fatty acids, which have powerful heartburn-relieving properties. Green leafy vegetables, spinach, kale, chard, and arugula are full of antioxidants and heartburn-relieving compounds like vitamin C, vitamin E, beta-carotene, and folic acid. Berries, blueberries, raspberries, strawberries and blackberries are rich in antioxidants and flavonoids that can fight inflammation. Turmeric. Turmeric contains the heartburn-relieving compound curcumin, which is considered one of the most effective natural anti-inflammatories. Ginger. Ginger contains gingerols and shogaols, which have powerful heartburn-relieving properties and can help reduce inflammation. Olive oil. Extra virgin olive oil contains heartburn-relieving antioxidants and monounsaturated fatty acids that can reduce inflammation. Nuts and seeds. Walnuts, flax seeds, chia seeds, and almonds are rich in healthy fats, fiber, and antioxidants that can fight inflammation. Garlic. Garlic contains sulfur-containing compounds that may have heartburn-relieving properties and boost the immune system. Green tea. Green tea is rich in polyphenols and antioxidants that can reduce inflammation and promote health. Papaya. Papaya is rich in vitamin C and enzymes like papain, which may have heartburn-relieving properties. These foods can be combined in a balanced diet to reduce inflammation in the body and promote good health. It's important to note that a healthy diet overall, rich in fruits, vegetables, whole grains, lean protein, and healthy fats, can have a heartburn-relieving effect. Antioxidants and their importance in fighting inflammation. Antioxidants play an important role in fighting inflammation in the body. They are molecules that neutralize free radicals and can thus prevent cell damage and inflammatory reactions. Free radicals are unstable molecules that can be produced during normal metabolic processes in the body, but are also aggravated by factors such as environmental pollution, smoking, excessive alcohol consumption, and an unhealthy diet. Inflammation is a natural part of the body's immune response to injury and infection. However, chronic inflammation that persists over a long period of time can lead to various diseases, including cardiovascular disease, diabetes, rheumatoid arthritis, and cancer. This is where antioxidants come in, as they can help reduce the harmful effects of chronic inflammation. Antioxidants work by scavenging free radicals and neutralizing their damaging effects. They can prevent the oxidation of cells and tissues and reduce inflammatory responses in the body. By neutralizing free radicals, antioxidants can help dampen the inflammatory response and reduce damage to tissues and organs. Some of the most important antioxidants are vitamin C. Vitamin C is a powerful antioxidant that boosts immune function and can reduce the production of pro-inflammatory substances. It is abundant in citrus fruits, berries, peppers, and green leafy vegetables. Vitamin E. Vitamin E protects cells from free radical damage and has heartburn-relieving properties. It is found in foods such as nuts, seeds, vegetable oils, and green leafy vegetables. Beta-carotene. Beta-carotene is a precursor to vitamin A and a powerful antioxidant. It is found in orange vegetables such as carrots, sweet potatoes, and pumpkin. Flavonoids. Flavonoids are a group of plant compounds with powerful antioxidant and heartburn-relieving properties. They are found in foods such as berries, grapes, green tea, dark chocolate, and many fruits and vegetables. Selenium. Selenium is a mineral that acts as a cofactor for antioxidant enzymes in the body. It is found in Brazil nuts, fish, seafood, whole grains, and legumes. It is important to note that a balanced diet rich in a variety of fruits, vegetables, whole grains, nuts, and seeds provides the best sources of antioxidants. Omega-3 fatty acids and their heartburn-relieving properties. Omega-3 fatty acids are essential fatty acids that are vital for good health because the body cannot produce them on its own. They play an important role in fighting inflammation in the body and have heartburn-relieving properties. There are three main types of omega-3 fatty acids: eicosapentaenoic acid, EPA, docosahexaenoic acid, DHA, and alpha-linolenic acid, ALA. EPA and DHA are found primarily in fatty marine fish such as salmon, mackerel, sardines, and herring. These omega-3 fatty acids have powerful heartburn-relieving properties. They can reduce the production of inflammatory messengers in the body and decrease the activity of inflammatory cells and enzymes. This can help reduce the effects of inflammation in the body. ALA is found in plant sources such as flax seeds, chia seeds, walnuts, and hemp seeds. The body can convert ALA into EPA and DHA in limited amounts. Although the conversion efficiency is low, consuming ALA-rich foods can provide the body with some heartburn-relieving omega-3 fatty acids. The heartburn-relieving properties of omega-3 fatty acids are due to several mechanisms. They can reduce the production of pro-inflammatory eicosanoids and promote the synthesis of heartburn-relieving eicosanoids. Furthermore, they influence the function of immune cells and inflammatory cytokines, leading to a reduction in inflammatory responses. Adequate intake of omega-3 fatty acids can help reduce chronic inflammation in the body and reduce the risk of inflammation-related diseases such as cardiovascular disease, rheumatoid arthritis, inflammatory bowel disease, and metabolic syndrome. In addition, omega-3 fatty acids may also have positive effects on brain function, eye health, and mood. It's important to note that a balanced diet rich in omega-3 fatty acids, combined with a healthy lifestyle, is beneficial. In addition to consuming oily fish and plant sources of omega-3 fatty acids, supplements may also be considered to ensure the body receives adequate amounts of these heartburn-relieving fatty acids. However, it is recommended to seek medical advice before taking any supplements. Nutrition plans and recipes. In this chapter, we'd like to introduce you to some helpful meal plans and heartburn-relieving recipes that you can incorporate into your diet. A heartburn-relieving diet should be balanced and include a variety of nutrient-rich foods. Here are some sample meals and recipes that may serve as inspiration. Breakfast. Greek yogurt with berries and a handful of nuts. Oat flakes with almond milk. Chia seeds and a pinch of cinnamon. Scrambled eggs with spinach. Tomatoes and avocado. Lunch. Quinoa salad with grilled vegetables. Olive oil and lemon juice. Fried salmon with broccoli and brown rice. Colorful salad with arugula. Tomatoes. Cucumbers. Peppers and roasted chicken. Snacks. Carrot sticks with hummus. Almonds or walnuts. Apple slices with almond butter. Dinner. Grilled chicken with steamed vegetables and quinoa. Oven roasted vegetables with lentils and a touch of balsamic dressing. Zucchini noodles with a tomato basil sauce and roasted pine nuts. Desserts. Greek yogurt with honey and chopped nuts. Berry smoothie with coconut milk and flaxseed. Dark chocolate at least 70% cocoa, with almonds. It's important that you adapt these recipes to your individual preferences and dietary needs. Make sure to use fresh, high-quality ingredients and avoid processed foods, trans fats, and excessive sugar. Remember that a heartburn-relieving diet should be long-term and sustainable for best results. In addition to the recipes mentioned, you can also search online for other heartburn-relieving recipes or use specialized cookbooks that focus on heartburn-relieving diets. General heartburn relief diet plan. Breakfast. Green smoothie with spinach, avocado, berries, flax seeds and almond milk. Snack. Carrot sticks with hummus. Lunch. Grilled chicken with quinoa salad. Quinoa. Cucumbers. Tomatoes. Parsley. Lemon juice and olive oil. Snack. Almonds and a handful of berries. Dinner. Grilled salmon with steamed broccoli and sweet potato mash. Dessert. Greek yogurt with honey and chopped walnuts. Heartburn relieving diet plan for vegetarian/vegan diets. Breakfast. Chia pudding with coconut milk. Oat flakes. Berries and chopped nuts. Snack. Apple slices with almond butter. Lunch. Quinoa vegetable stir fry with peppers, zucchini, tomatoes and seasoned chickpeas. Snack. Kale chips. Dinner. Fried tofu with steamed vegetables, broccoli, carrots, cauliflower, and brown rice. Dessert. Coconut milk chia pudding with mango and mint. Heartburn relieving diet plan for weight loss. Breakfast. Scrambled eggs with spinach, peppers and tomatoes. Snack. Quark with berries. Lunch. Grilled chicken breast fillet with vegetable salad, arugula, cucumber, tomatoes, avocado and balsamic dressing. Snack. Celery sticks with almond butter. Dinner. Grilled salmon with steamed asparagus and quinoa. Dessert. Greek yogurt with cinnamon and chopped almonds. Recipes for heartburn relieving meals and snacks. Oatmeal chia pudding. Ingredients. 1/2 cup oatmeal. 2 tablespoons chia seeds. 1 cup almond milk. Unsweetened. 1 teaspoon honey or maple syrup. Optional. Fresh berries for garnishing. Preparation. Combine oats, chia seeds, and almond milk in a bowl. Stir well and place the bowl in the refrigerator for at least 2 hours until the mixture turns into a pudding. Optionally, you can add honey or maple syrup to sweeten the pudding. Serve the oatmeal chia pudding with fresh berries as a topping. Quinoa salad with grilled vegetables. Ingredients. 1 cup quinoa. Vegetables of your choice. For example, peppers, zucchini, eggplant. Olive oil for grilling. Juice of 1 lemon. Fresh herbs. For example, parsley, coriander. Salt and pepper to taste. Preparation. Cook the quinoa according to the instructions on the package. Grill the vegetables with a little olive oil until soft and lightly browned. In a bowl, mix the cooked quinoa, grilled vegetables, lemon juice, fresh herbs, salt and pepper. Stir well and serve the quinoa salad as a side dish or main course. Turmeric lentil soup. Ingredients: 1 cup red lentils, 1 onion, chopped, 2 carrots, diced, 2 celery sticks, diced, 2 garlic cloves, chopped, 1 teaspoon turmeric powder, 4 cups vegetable broth, salt and pepper to taste, fresh coriander leaves for garnishing. Preparation: in a large pot, fry the onion, carrots, celery and garlic with a little oil until soft. Add the red lentils, turmeric powder and vegetable stock. Bring to a boil, then reduce the heat. Simmer the soup for about 20-25 minutes, until the lentils are tender. Season with salt and pepper. Garnish the soup with fresh coriander leaves and serve. Breakfast recipes: avocado egg toast. Ingredients: 2 slices of wholemeal bread, 1 ripe avocado, 2 eggs, salt and pepper to taste, fresh herbs, for example coriander or parsley, for garnishing. Preparation: toast the whole grain bread slices. In the meantime, slice the ripe avocado or mash it lightly. Fry or poach the eggs in a pan. Spread the toasted bread slices with avocado and place a fried egg on each one. Season with salt, pepper and fresh herbs and serve. Berry chia smoothie bowl. Ingredients: 1 cup mixed berries. For example, strawberries, blueberries, raspberries. 1 ripe banana. 1 tablespoon chia seeds. 1 cup almond milk, unsweetened. Toppings of your choice. For example, chopped nuts, coconut flakes, granola. Preparation: in a blender, blend the mixed berries, ripe banana, chia seeds and almond milk until creamy. The smoothie mixture into a bowl. Top with chopped nuts, coconut flakes or granola. Enjoy the berry chia smoothie bowl immediately. Scrambled eggs with vegetables. Ingredients: 3 eggs. Vegetables of your choice. For example, spinach, peppers, onions, tomatoes. Salt and pepper to taste. Optional. Spices such as turmeric or paprika. Preparation: cut the vegetables into small pieces as desired. Whisk the eggs in a bowl and season with salt, pepper and optional spices. Heat some oil in a pan and fry the vegetables until soft. Pour the beaten eggs over the vegetables and let them set, stirring constantly. Place the scrambled eggs on a plate and garnish with fresh herbs if desired. Quinoa breakfast bowl. Ingredients: 1/2 cup quinoa, 1 cup almond milk, unsweetened, 1 teaspoon honey or maple syrup, fresh berries, chopped nuts, for example almonds or walnuts, cinnamon for sprinkling. Preparation: rinse the quinoa thoroughly and place it in a pot with almond milk. Bring to a boil, then reduce heat. Cover and simmer the quinoa for about 15-20 minutes, until tender and the liquid is absorbed. The cooked quinoa with honey or maple syrup and divide into bowls. Garnish with fresh berries, chopped nuts and a pinch of cinnamon. The quinoa breakfast bowl warm or cold. Sweet potato scrambled eggs. Ingredients: 1 medium sweet potato, 3 eggs, 1/2 onion, chopped, handful of spinach, salt and pepper to taste, coconut oil for frying. Preparation. Peel the sweet potato and cut it into small cubes. Heat some coconut oil in a pan and fry the sweet potato cubes until they are soft and lightly browned. Add the chopped onion and continue frying until translucent. Whisk the eggs in a bowl and pour over the sweet potato and onion mixture. Add the spinach and cook, stirring, until the eggs are set. Season with salt and pepper and serve the sweet potato scrambled eggs hot. Apple cinnamon oatmeal. Ingredients: 1/2 cup oatmeal, 1 cup almond milk, unsweetened, 1 apple, diced, 1 tablespoon almond butter, 1 teaspoon honey or maple syrup, optional, pinch of cinnamon. Preparation. In a saucepan, mix the oat flakes and almond milk. Place the pot over medium heat and bring the oatmeal to a boil, stirring occasionally. Once the oats are boiling, reduce the heat and simmer for another 5-7 minutes, until the oats are soft and creamy. Stir occasionally. Add the diced apple, almond butter, honey or maple syrup, if using, and a pinch of cinnamon. Mix the ingredients well and simmer for another 2-3 minutes until the apple has softened. Place the apple cinnamon oatmeal in a bowl and garnish with additional toppings such as chopped nuts, raisins or fresh fruit, if desired. Serve hot and enjoy. This recipe provides you with a delicious and healthy breakfast option filled with the aroma of apples and cinnamon to keep you energized and full. Grilled salmon with quinoa and steamed vegetables. Ingredients: 1 salmon fillet, juice of 1 lemon, salt and pepper to taste, 1/2 cup quinoa, vegetables of your choice, for example broccoli, carrots, green beans, olive oil. Preparation. Drizzle the salmon with lemon juice and season with salt and pepper. Grill or fry the salmon on the grill or in a pan with a little olive oil over medium heat until cooked through. In the meantime, cook the quinoa according to the package instructions. Steam the vegetables or fry them in a pan with a little olive oil until soft. The grilled salmon with quinoa and steamed vegetables. Tips for the practical implementation of a heartburn-relieving diet in everyday life. Planning and preparation. Plan your meals in advance and create a shopping list of foods that relieve heartburn. Prepare healthy snacks and meals that you can easily take with you, such as vegetable sticks with hummus or quinoa salads. Invest in storage containers and jars to store leftovers and make them easy to carry. Variety and fresh ingredients. Focus on a varied selection of fruits, vegetables, whole grains, nuts, seeds and healthy fats. Buy fresh ingredients, organic if possible, to avoid pesticides and other harmful substances. Avoid processed foods. Reduce your consumption of processed foods such as fast food, convenience foods, refined sugar, and saturated fats. Read labels and avoid foods that contain additives, artificial flavors, colors, or trans fats. Cooking methods. Prefer gentle cooking methods such as stewing, grilling, baking or steaming instead of frying or roasting. Use high-quality vegetable oils such as olive oil or avocado oil instead of refined oils. Spices and herbs. Use heartburn-relieving spices like turmeric, ginger, cinnamon, garlic, and cayenne pepper to enhance the flavor of your dishes. Use fresh herbs like basil, cilantro, or parsley to increase the nutritional content. Hydration. Drink plenty of water to hydrate your body and flush out toxins. Avoid excessive consumption of sweetened drinks and alcohol. Eating with mindfulness. Take your time for your meals and eat mindfully. Pay attention to satiety and listen to your body to avoid overeating. Exchange and support. Connect with others who practice a heartburn-relieving diet and share experiences, recipes, and tips. Seek support from a nutritionist or doctor to adjust your diet and address individual needs. By incorporating these tips into your daily routine, you can successfully implement a heartburn-relieving diet and reap the long-term health benefits. Further measures to combat inflammation. This chapter presents additional measures that can help combat inflammation. In addition to a diet that relieves heartburn, there are other factors that can influence inflammation in the body. Here are some important aspects to consider. Stress management. Chronic stress can increase inflammation in the body. Therefore, it's important to learn effective stress management techniques and integrate them into your daily routine, such as meditation, yoga, breathing exercises, or regular physical activity. Sufficient sleep. Lack of sleep and poor sleep quality can lead to inflammation in the body. It's advisable to get enough sleep and maintain healthy sleep habits, such as maintaining a regular bedtime, a quiet sleep environment, and avoiding stimulants before bedtime. Physical activity. Regular physical exercise can help relieve heartburn. It's advisable to include a mix of aerobic exercise, such as jogging, cycling, or swimming, and strength training in your weekly workout routine. Consult a doctor or athletic trainer to determine the appropriate activity and intensity for you. Do not smoke. Smoking is associated with an increased risk of inflammation and chronic disease. If you smoke, it's important to take steps to quit. There are various resources and programs available to help you do this. Weight management. Overweight and obesity can promote inflammation in the body. It's important to strive for a healthy body weight and, if necessary, take measures to reduce weight. A balanced diet and regular physical activity play an important role in this. Medical treatment. In some cases, medical treatment may be necessary to control inflammation in the body. Discuss possible options with a doctor or specialist to determine the best treatment strategies for your individual situation. It's important to note that these additional measures are intended to complement, not replace, a heartburn-relieving diet. By considering these factors holistically, you can actively contribute to reducing inflammation and promoting your long-term health. Importance of exercise and physical activity. The importance of exercise and physical activity for our health cannot be overemphasized. Regular physical activity has a variety of positive effects on our bodies and our well-being. Here are some of the key reasons why exercise is so important. Cardiovascular health. Physical activity strengthens the heart and improves circulation. Regular exercise reduces the risk of heart disease, high blood pressure, and stroke. Weight control. Exercise plays a crucial role in maintaining a healthy body weight. Physical activity burns calories and supports muscle building, which boosts metabolism and helps us avoid or lose excess weight. Strengthening the immune system. Moderate physical activity strengthens the immune system and can help fight off infections and diseases. Regular exercise has been shown to increase the number and activity of immune cells. Improved mood. Exercise has a positive effect on our mental health. It helps reduce stress, anxiety, and improves mood. Physical activity leads to the release of endorphins, the so-called happy hormones, which create a feeling of well-being. Strengthening muscles and bones. Regular exercise can improve muscle strength and endurance. Strength training and high-impact activities support muscle mass building and contribute to strengthening bones, which reduces the risk of osteoporosis. Improved brain function. Studies have shown that exercise has positive effects on cognitive function. Regular physical activity improves memory, attention, and thinking skills. Prevention of chronic diseases. Regular exercise can reduce the risk of chronic diseases such as diabetes, certain cancers, and metabolic syndrome. It can also help reduce the risk of Alzheimer's disease and dementia in old age. It's important to note that exercise doesn't just involve intense workouts. Even moderate activities like walking, cycling, dancing, or gardening can have positive effects. It's advisable to incorporate regular exercise into your daily routine and choose activities that are enjoyable and fit well into your personal lifestyle. Before you start a new training program, it is recommended to consult a doctor to ensure that you are healthy enough for certain activities. Stress management and relaxation techniques. Stress management and relaxation techniques play an important role in our physical and mental health. In our hectic and stressful world, it's crucial to find ways to reduce stress and restore our inner balance. Here are some proven stress management techniques and relaxation methods. Breathing exercises. Deep, conscious breathing is a simple and effective way to reduce stress. Try sitting for a few minutes and focusing on your breathing. Breathe in slowly and deeply through your nose and exhale slowly through your mouth. Repeat this several times and notice how your breathing deepens and your body relaxes. Meditation. Meditation is a proven method for managing stress. Sit in a quiet place. Close your eyes and focus on your breathing, a specific mantra, or a calming image. Allow your thoughts to come and go without getting carried away by them. Meditation helps calm the mind, reduce stress, and create clarity. Progressive muscle relaxation. In this technique, you consciously tense different muscle groups and then slowly release them. Start with your toes and work upward through your body. This helps release muscle tension and achieve deep relaxation throughout your entire body. Yoga. Yoga combines physical movement with breathing techniques and meditation. It helps reduce stress, build flexibility and strength, and improve overall well-being. There are different styles of yoga, from calm and meditative practices to more dynamic and powerful styles. Find a style that suits you and can be practiced regularly. Physical activity. Regular physical activity helps reduce stress and improve mood. Whether it's walking, running, dancing, or other sports, find an activity that brings you joy and can be incorporated into your daily routine. Exercise promotes the release of endorphins, the natural feel-good hormones, and helps reduce tension. Time for yourself. Consciously take time for yourself to recharge and relax. Whether it's taking a hot bath, reading a book, listening to music, or pursuing a hobby, find activities that bring you joy and relaxation. Social support. Talk to friends, family members, or a therapist about your worries and fears. Sharing ideas and receiving support from others can help you manage stress and gain new perspectives. Sleep and its role in inflammation regulation. Sleep plays a crucial role in regulating inflammation and maintaining optimal health. During sleep, we go through various sleep stages that are important for the body's repair and renewal. Here are some points that highlight the importance of sleep for inflammation regulation. Inflammation regulation. Inflammatory processes in the body are regulated during sleep. Chronic sleep deprivation or disturbed sleep can lead to an overproduction of pro-inflammatory substances and exacerbate chronic inflammation in the body. Adequate, high-quality sleep helps reduce inflammation and maintain balance in the immune system. Immune function. Sleep plays an important role in strengthening the immune system. During sleep, immune cells are activated and antibodies are produced, which play a crucial role in fighting infections and regulating inflammation. A well-functioning immune system is crucial for fighting inflammation and preventing disease. Hormone regulation. Sleep influences the production and regulation of various hormones in the body, including hormonal mediators of inflammation. Disturbed sleep can lead to dysregulation of these hormones, which in turn can lead to an increased tendency toward inflammation. Adequate sleep helps maintain a healthy hormonal balance and control inflammation. Cellular repair and recovery. During sleep, cellular repair and renewal occur. Tissues and organs are repaired, cells are renewed, and the body recovers from daily stresses. This recovery process is important for reducing inflammation and promoting health at the cellular level. Stress management. Sleep plays a crucial role in managing stress. Chronic sleep deprivation can lead to increased susceptibility to stress, as the body is less able to regulate stress hormones. Stress, in turn, can promote inflammation. Adequate sleep helps reduce stress and reduce the risk of stress-related inflammation. It's important to practice good sleep hygiene to improve the quality and quantity of sleep. This includes maintaining a regular bedtime, creating a quiet sleep environment, avoiding stimulants like caffeine before bedtime, and creating a relaxing sleep routine. Conclusion. A heartburn-relieving diet is an important component in fighting inflammation in the body. Eating heartburn-relieving foods like fruits, vegetables, whole grains, healthy fats, and spices can reduce inflammation and promote health. It's also important to reduce or avoid pro-inflammatory foods like sugary drinks, processed foods, and trans fats. In addition to diet, there are other measures that can help combat inflammation. These include stress management and relaxation techniques such as breathing exercises, meditation, yoga, and physical activity. Adequate sleep also plays a crucial role in regulating inflammation and maintaining optimal health. It's important to integrate the heartburn-relieving diet and other measures into your daily routine to reap their long-term benefits. It's recommended to consider individual needs and preferences and, if necessary, seek advice from a doctor or nutritionist. By taking a holistic approach to nutrition, stress management, physical activity and sleep, we can actively contribute to reducing inflammation and promoting our long-term health. The long-term benefits of a heartburn-relieving diet. A heartburn-relieving diet can provide numerous long-term health benefits. Here are some of the long-term benefits associated with a heartburn-relieving diet. Reduced risk of chronic diseases. Chronic inflammation plays a key role in the development of diseases such as heart disease, type 2 diabetes, certain cancers, Alzheimer's disease, and autoimmune diseases. By reducing inflammation in the body, a heartburn-relieving diet can reduce the risk of these diseases in the long term. Improved heart health. Inflammation is closely linked to heart disease. A heartburn-relieving diet rich in fruits, vegetables, whole grains, healthy fats, and antioxidants can help lower cholesterol, regulate blood pressure, and improve overall cardiovascular health. Weight control. A heartburn-relieving diet based on nutrient-dense foods can help control weight. Excess body fat can lead to chronic inflammation, while a healthy weight is associated with a lower risk of inflammation. Improved digestive health. Inflammation can also affect the gastrointestinal tract, leading to digestive conditions such as irritable bowel syndrome, inflammatory bowel disease, and heartburn. A heartburn-relieving diet that includes fiber-rich foods, healthy fats, and fermented foods can support digestive health and reduce inflammation in the digestive system. Stronger immune system. A heartburn-relieving diet rich in antioxidants, vitamins, and minerals can strengthen the immune system and improve the body's defenses against infections and diseases. A well-functioning immune system is important for fighting inflammation and maintaining optimal health. Improved mood and mental health. Inflammation can also impact mood and mental health. A heartburn-relieving diet that includes healthy fats and omega-3 fatty acids can help improve brain function, stabilize mood, and reduce the risk of depression and anxiety. Summary of key findings and recommendations. A heartburn-relieving diet can offer many long-term health benefits. The most important findings and recommendations can be summarized as follows. Inflammation is a natural process in the body that helps fight infections and repair tissue. However, chronic inflammation can lead to various diseases. A heartburn-relieving diet is based on eating foods that reduce inflammation and promote balance in the body. These include fruits, vegetables, whole grains, healthy fats, lean protein, and spices. Sugar, trans fats and processed foods should be avoided as they can promote inflammation. Antioxidants, omega-3 fatty acids, and fiber are important nutrients that have heartburn-relieving properties and should be included in a heartburn-relieving diet. A heartburn-relieving diet can reduce the risk of chronic diseases such as heart disease, diabetes, cancer, and neurodegenerative diseases. In addition to diet, exercise, stress management, adequate sleep and healthy lifestyle habits also play an important role in fighting inflammation and maintaining optimal health. It is advisable to consider individual needs and preferences and, if necessary, seek advice from a doctor or nutritionist to incorporate a heartburn-relieving diet into your daily routine. Switching to a heartburn-relieving diet may take time and adjustments, but the long-term health benefits are worth it. Making the right food choices and incorporating a healthy lifestyle can reduce inflammation and improve overall health. Glossary of technical terms. The glossary of terms explains key terms and definitions used in the Heartburn Relief Diet book. This can help readers better understand the vocabulary and grasp the concepts in the book. Here are some examples of terms that might be included in the glossary. Inflammation, the body's natural response to injury or infection, aimed at repairing the damage and fighting off pathogens. However, chronic inflammation can be harmful and lead to various diseases. Antioxidants, substances that can protect the body from damage caused by free radicals. They are found in many plant foods such as fruits, vegetables, nuts, and spices. Omega-3 fatty acids, a type of polyunsaturated fatty acid that has heartburn-relieving properties. They are found in fatty fish, flax seeds, chia seeds, and walnuts. Fiber, undissolved plant fiber found in fruits, vegetables, whole grains, legumes, and nuts. Fiber supports healthy digestion and can reduce inflammation. Trans fats, artificially produced fats created through a process of partial or complete hydrogenation of vegetable oils. They are known to promote inflammation and increase the risk of heart disease. Anti-inflammatory foods. Foods that have heartburn-relieving properties and can help reduce inflammation in the body. These include berries, leafy greens, turmeric, and olive oil. Glycemic index. A measure of how quickly a carbohydrate-containing food causes blood sugar levels to rise. Foods with a low glycemic index are digested more slowly and have less impact on blood sugar and inflammatory processes. The glossary provides readers with a quick and clear definition of the technical terms used and helps them better understand the book and implement the concepts of the heartburn-relieving diet. Anti-sod race. Recipes. Colorful fruit skewers with peanut butter dip. That sounds like a delicious and healthy breakfast. Here are the recipes for colorful fruit skewers with peanut butter dip and oatmeal with fruit and nuts. Colorful fruit skewers with peanut butter dip. Ingredients. Various fresh fruits of your choice. For example, strawberries, grapes, pineapple, melon, kiwi, bananas. Wooden skewers. 1 stroke 2 cup peanut butter. Use a vegan version. 2 tablespoons maple syrup or agave syrup. Optional for sweetness. A splash of lemon juice. To prevent the fruit from turning brown. Directions. Wash and peel the fruit. If necessary. Cut it into bite-sized pieces or shapes. Dip the wooden skewers in water to ensure they don't splinter. Alternate the fruit pieces on the skewers to create colorful fruit skewers. In a small bowl, combine the peanut butter, maple syrup, if using, and lemon juice. Stir well until you have a smooth dipping sauce. Oatmeal with fruits and nuts. Oatmeal with fruits and nuts. Ingredients. 1 cup oatmeal. Use gluten-free oatmeal if desired. 2 cups plant milk. For example, almond, soy, oat milk. A pinch of salt. 1 teaspoon vanilla extract. Optional. Fresh or frozen fruits of your choice. For example, berries, bananas, apples, nuts and seeds. For example, almonds, walnuts, chia seeds. Maple syrup or agave syrup to sweeten. Optional. Directions. In a saucepan, combine the oats, plant milk, a pinch of salt and vanilla extract, if using. Bring to a boil, then reduce heat to medium. Simmer, stirring occasionally, until the porridge reaches your desired consistency, usually about 5-7 minutes. Divide the porridge into bowls and garnish with fresh or frozen fruit, nuts, and seeds. Sweeten with maple syrup or agave syrup if desired and serve immediately. These 2 recipes are not only delicious, but also nutritious and filling. Enjoy your vegan breakfast. Vegan pancakes with maple syrup. Ingredients. 1 cup flour. Wheat flour or a gluten-free flour of your choice. 2 tablespoons sugar. 1 tablespoon baking powder. A pinch of salt. 1 cup plant milk. For example, almond, soy or oat milk. 2 tablespoons vegetable oil. For example, rapeseed oil or coconut oil. 1 teaspoon vanilla extract. Optional. Maple syrup for serving. Fresh fruit for garnishing. For example, berries, bananas. Directions. In a large bowl, combine flour, sugar, baking powder and salt. In another bowl, mix plant milk, vegetable oil and vanilla extract, if using. Pour the wet ingredients into the dry ingredients and mix well until a smooth batter forms. If the batter is too thick, you can add a little more plant-based milk. Lightly grease a frying pan and heat it over medium heat. Pour the batter into the pan in batches to form pancakes. Fry them until golden brown on each side. Place the pancakes on plates. Drizzle with maple syrup. And garnish with fresh fruit. Serve immediately. Tofu scrambled eggs with vegetables. Ingredients: 1 block of firm tofu, well drained and crumbled. 1 tablespoon vegetable oil. 1 stroke 2 onion, diced. 1 bell pepper, diced. 1 tomato, diced. 2 teaspoons of turmeric, for the color. Salt and pepper to taste. Fresh vegetables for garnishing. For example, coriander, spring onions. Directions: heat the vegetable oil in a pan and fry the diced onion until translucent. Add the peppers and tomatoes and fry for a few minutes until soft. Add the crumbled tofu, turmeric, salt, and pepper. Fry everything together until the tofu is thoroughly heated and takes on the color of scrambled eggs. Serve the tofu scramble on a plate and garnish with fresh vegetables if desired. Healthy smoothie bowls. Ingredients: 2 ripe bananas, cut into pieces and frozen. 1 cup frozen mixed berries. For example, strawberries, blueberries, raspberries. 1 cup spinach or kale. 1 cup plant milk. For example, almond, soy or oat milk. 2 tablespoons chia seeds. Fresh fruit, nuts and seeds for garnishing. Directions: in a blender, puree the frozen bananas, frozen berries, spinach or kale, and plant milk until thick and creamy. Pour the smoothie into a bowl. Sprinkle chia seeds over the smoothie and garnish with fresh fruit, nuts, and seeds of your choice. Enjoy your healthy smoothie bowl immediately. These recipes are not only delicious but also full of nutrients and are perfect for a healthy breakfast. Delicious snacks. Vegetable sticks with hummus. Ingredients: various vegetables of your choice. For example, carrots, peppers, celery, cucumbers, cherry tomatoes. Hummus homemade or store-bought. Directions: wash and peel the vegetables, if necessary. Cut them into manageable sticks or slices. Serve the vegetables on a plate or platter along with a bowl of hummus. Dip the vegetable sticks in the hummus and enjoy them as a healthy snack. Fruity yogurt bars. Ingredients: 2 cups oatmeal. 1 cup unsweetened applesauce. 1 stroke 2 cup unsweetened almond or soy yogurt. 1 stroke 4 cup maple syrup or agave syrup. 1 teaspoon vanilla extract. 1 cup dried fruit of your choice. For example, raisins, apricots, cranberries. 1 stroke 2 cup chopped nuts or seeds. For example, almonds, walnuts, chia seeds. Directions: in a large bowl, combine oats, applesauce, almond or soy yogurt, maple syrup, and vanilla extract. Add the dried fruit and chopped nuts or seeds. Stir well until evenly distributed. Line a baking pan with baking paper and press the oat mixture evenly into the pan. Let the mixture set in the refrigerator for at least 2 hours or overnight. Remove the solid bars from the mold. Cut into pieces. And enjoy. You can store them in an airtight container in the refrigerator. Guacamole and corn chips. Ingredients: 3 ripe avocados. Juice of 1-2 limes. 1 tomato, diced. 1 stroke 4 cup diced onion. 1 garlic clove, chopped. 1 stroke 4 cup fresh cilantro leaves, chopped. Salt and pepper to taste. Corn chips or tortilla chips for dipping. Directions: halve the avocados. Remove the pit and scoop out the flesh with a spoon. In a bowl, mash the avocado with a fork. Add the lime juice and stir well. Add the diced tomato, onion, garlic, and cilantro. Mix well. Season with salt and pepper. You can also add some chili or jalapenos if you like it spicy. Serve the guacamole with corn chips or tortilla chips for dipping. Enjoy this creamy and savory snack. These recipes are easy to prepare and perfect for healthy snacks or appetizers. Enjoy them with a social gathering or as a delicious snack between meals. Vegan mini pizzas. Ingredients. For the dough: 1 pizza dough, vegan and pre-made or homemade. Flour for rolling out. For the tomato sauce: 1 cup strained tomatoes, 1 teaspoon olive oil, 1 teaspoon dried Italian herbs, salt and pepper to taste. Toppings of your choice. Vegan cheese. For example, vegan mozzarella. Chopped vegetables. For example, peppers, tomatoes, onions, olives. Vegan ham or tofu sausages. Optional. Fresh herbs. For example, basil or oregano. Directions. Preheat your oven to the recommended temperature for the pizza dough. Roll out the pizza dough on a lightly floured surface and cut it into small circles or squares to form mini pizzas. For the tomato sauce, heat olive oil in a saucepan. Add crushed tomatoes, dried herbs, salt, and pepper. Bring to a boil briefly, then set aside. Place the dough pieces on a baking tray lined with baking paper. Spread each mini pizza base with the tomato sauce and add your desired toppings. Don't forget the vegan cheese, if using it. Bake the mini pizzas according to the instructions on the pizza dough until the dough is golden brown and the cheese is melted. Serve the mini pizzas hot and garnish with fresh herbs if desired. Vegan quesadillas. Ingredients: 4 large tortillas, vegan. 1 cup vegan grated cheese. 1 can of black beans, drained and rinsed. 1 red bell pepper, diced. 1 small onion, diced. 1 teaspoon olive oil. Spices to taste. For example, cumin, paprika, chili powder, guacamole or salsa to serve. Optional. Directions. Heat the olive oil in a pan and sauté the diced onion and bell pepper until softened. Add the black beans and seasonings and cook for a few minutes. Let the mixture cool. Spread a layer of vegan cheese on 1 tortilla, followed by the bean and pepper mixture. Place a second tortilla on top. Heat a pan over medium heat and carefully place the quesadilla in it. Cook on both sides until golden brown and the cheese is melted. Repeat the process for the remaining quesadillas. Cut the quesadillas into quarters and serve them hot, perhaps with guacamole or salsa. These vegan mini pizzas and quesadillas make delicious snacks or meals and can be customized with different vegetables and spices to your liking. Enjoy them alone or with good company. Lunch and dinner. Lunch and dinner are crucial meals throughout the day that provide our bodies with the energy and nutrients they need. Here's why they are important and which proteins and vitamins you should include in your diet. Importance of lunch and dinner. Energy supply. Lunch and dinner provide the energy we need to carry out our daily activities and maintain our metabolism. Nutrient intake. These meals are opportunities to consume important nutrients such as proteins, carbohydrates, fats, vitamins and minerals that are essential for our health. Blood sugar levels. Regular meals help keep blood sugar levels stable and avoid cravings or energy slumps. Satiety. Lunch and dinner help support satiety and prevent excessive snacking between meals. Social interaction. These meals can provide opportunities to spend time with family, friends, or colleagues and strengthen social bonds. Proteins and vitamins you need. Proteins. Proteins are important for building and repairing tissues in the body. The best vegan protein sources include legumes, beans, lentils, chickpeas, tofu, tempeh, nuts, seeds, quinoa, and whole grains. Vitamins. Ensure you get enough vitamins, especially vitamin B12, vitamin D, vitamin C, and folic acid. These vitamins are important for the immune system, bone health, and overall health. They can be obtained from fortified foods, supplements, or a diverse plant-based diet. Minerals. Minerals such as calcium, iron, zinc, and magnesium are also important. These are found in foods such as green leafy vegetables, nuts, seeds, whole grains, and legumes. Fiber. Fiber is important for digestion and can help regulate blood sugar levels. It is found in plant-based foods such as whole grains, vegetables, and legumes. Antioxidants. Antioxidants, which are abundant in fruits and vegetables, protect our cells from free radical damage and are important for overall health. Lunch and dinner should be balanced meals that contain a variety of nutrients to meet your body's needs. A varied, plant-based diet, combined with careful planning, can ensure you get all the protein and vitamins you need. If you have specific dietary concerns, it's advisable to consult a nutritionist or doctor to ensure your diet is balanced. Colorful vegetable noodle soup. Ingredients: 200 grams whole wheat pasta, or a pasta variety of your choice. 1 liter vegetable broth. 1 onion, diced. 2 carrots, thinly sliced. 2 celery sticks, thinly sliced. 1 red bell pepper, diced. 1 small zucchini, diced. 1 cup peas, fresh or frozen. 2 garlic cloves, chopped. 1 teaspoon olive oil. Salt and pepper to taste. Fresh herbs, for example parsley or chives, for garnishing. Optional. Directions. Cook the pasta according to the package instructions. Drain and set aside. Heat the olive oil in a large saucepan. Sauté the diced onion and garlic until softened. Add the carrots, celery, bell pepper, and zucchini and sauté for a few minutes until lightly browned. Pour the vegetable stock into the pan and bring to a boil. Then reduce the heat and simmer the soup until the vegetables are tender, usually 10-15 minutes. Add the peas and cook for another 2-3 minutes, or until heated through. Add the cooked pasta to the soup and stir. Season to taste with salt and pepper. Serve the colorful vegetable noodle soup in bowls and garnish with fresh herbs, if desired. Vegan-friendly vegetable curry. Ingredients: 1 cup basmati rice, or a rice variety of your choice. 1 tablespoon vegetable oil. 1 onion, diced. 2 garlic cloves, chopped. 1 tablespoon curry powder, or more to taste. 400 milliliters coconut milk. 2 carrots, thinly sliced. 1 red bell pepper, diced. 1 small broccoli floret. 1 can of chickpeas, drained and rinsed. Salt and pepper to taste. Fresh coriander or parsley for garnish. Optional. Directions. Cook the rice according to the instructions on the package. Heat the vegetable oil in a large pan. Sauté the diced onion and garlic until softened. Add the curry powder and fry briefly until fragrant. Add the carrots, bell peppers, and broccoli to the pan and sauté, stirring occasionally, until the vegetables are lightly browned. Add the coconut milk and mix well. Simmer the vegetables in the coconut milk until tender, usually 10-15 minutes. Add the chickpeas and cook for another 2-3 minutes until heated through. Season with salt and pepper to taste. Serve the vegetable curry over the rice and garnish with fresh cilantro or parsley, if desired. These 2 recipes are delicious, healthy, and easy to prepare. They are perfect for vegans and offer a good portion of vegetables in delicious dishes. Baked sweet potato nuggets. Ingredients. For the sweet potato nuggets, 2 medium sweet potatoes, peeled and cut into nugget-shaped pieces, 2 tablespoons olive oil, 1 teaspoon paprika powder, 1 teaspoon garlic powder, 1 teaspoon onion powder, 1 stroke 2 teaspoons salt, 1 stroke 4 teaspoon pepper, breadcrumbs, vegan. Cooking spray or more olive oil for greasing. For the dipping sauce, 1 stroke 2 cup vegan mayo, 1 tablespoon ketchup, 1 teaspoon mustard, 1 teaspoon maple syrup. Directions. Preheat the oven to 220 degrees Celsius and line a baking tray with baking paper. Place the sweet potato nuggets in a large bowl and toss with olive oil, paprika, garlic powder, onion powder, salt and pepper until the nuggets are well seasoned. The breadcrumbs in a separate shallow bowl. First coat each sweet potato nugget in the breadcrumbs, then place it on the prepared baking sheet. Generously spray the nuggets with cooking spray or brush with more olive oil to make them crispy. Bake the nuggets in the oven for about 20-25 minutes until they are golden brown and crispy. While the nuggets are baking, prepare the dipping sauce by mixing vegan mayo, ketchup, mustard, and maple syrup in a small bowl. Serve the baked sweet potato nuggets with the dipping sauce and enjoy. Vegan spaghetti bolognese. Ingredients: 200 grams whole wheat spaghetti, or a gluten-free alternative, 1 tablespoon olive oil, 1 onion, diced, 1 celery stick, diced, 2 garlic cloves, chopped, 1 carrot, diced, 1 red bell pepper, diced, 1 can, 400 g, diced tomatoes, 1 teaspoon dried basil, 1 teaspoon dried oregano, salt and pepper to taste, 1 cup lentils, cooked or canned, fresh basil or parsley for garnish, optional. Directions. Cook the spaghetti according to the package instructions. Drain and set aside. Heat the olive oil in a large pan. Sauté the diced onion and garlic until softened. Add the diced carrot, celery, and red bell pepper and sauté for a few minutes until softened. Add the diced tomatoes, dried basil, dried oregano, salt, and pepper. Simmer the sauce until slightly thickened, usually 10-15 minutes. Add the cooked lentils and cook for another 2-3 minutes until heated through. Pour the vegan bolognese sauce over the cooked spaghetti and garnish with fresh basil or parsley, if desired. These are 2 delicious vegan dishes that are both healthy and flavorful. The baked sweet potato nuggets are perfect for snacking or as a side dish, while the vegan spaghetti bolognese makes a hearty main course. Crispy tofu tacos. Ingredients. For the crispy tofu, 1 block of firm tofu, pressed and cut into small cubes, 2 tablespoons vegetable oil, 1 teaspoon paprika powder, 1 teaspoon cumin, 1 stroke 2 teaspoon garlic powder, 1 stroke 2 teaspoon onion powder, salt and pepper to taste. For the tofu marinade, 2 tablespoons soy sauce, 1 tablespoon maple syrup or agave syrup, 1 teaspoon sriracha or hot sauce, optional. For the taco filling, 8 small tortillas, vegan, 1 cup chopped fresh lettuce, for example iceberg lettuce or romaine lettuce, 1 tomato, diced, 1/2 red onion, diced. Vegan sour cream or vegan yogurt as a topping, optional. Fresh coriander or parsley for garnish, optional. Lime wedges for serving. Directions. Cut the tofu into cubes and mix it in a bowl with vegetable oil, paprika powder, cumin, garlic powder, salt and pepper. In a separate small bowl, combine the soy sauce, maple syrup or agave nectar, and sriracha if you like it spicier. To make the marinade, dip the tofu into the marinade, ensuring the cubes are well coated. Let the tofu sit in the marinade for about 10 minutes. Fry the tofu in a pan over medium heat until crispy and golden brown. This usually takes about 5-7 minutes per side. Heat the tortillas slightly, either in a pan or in the microwave. Fill each tortilla with crispy tofu, chopped lettuce, diced tomato, and diced red onion. If desired, you can add vegan sour cream or vegan yogurt as a topping and garnish with fresh cilantro or parsley. Serve the crispy tofu tacos with lime wedges, which can be squeezed over the filling to add a fresh flavor. These crispy tofu tacos are a delicious and protein-packed vegan dish that you can customize with a variety of toppings and seasonings. Enjoy them as a hearty meal for lunch or dinner. Quinoa salad with roasted vegetables. Ingredients: 1 cup quinoa, 2 cups of water, vegetables of your choice, for example peppers, zucchini, cherry tomatoes, eggplant, 2 tablespoons olive oil, salt and pepper to taste, 1/4 cup chopped fresh parsley or cilantro, juice of 1 lemon, vegan feta cheese, optional. Directions: the quinoa thoroughly in a sieve, then bring it to a boil in a saucepan with 2 cups of water. Reduce heat and simmer for 15-20 minutes until the water is absorbed. Remove from heat and let cool. Dice the vegetables as desired. Toss with olive oil, salt, and pepper, and spread on a baking sheet. Roast the vegetables in a preheated oven at 200 degrees Celsius for about 20-25 minutes, until lightly browned. The cooled quinoa in a large bowl and add the roasted vegetables. Add the chopped parsley or cilantro, lemon juice, and optional vegan feta cheese. Mix everything well. Season with additional lemon juice, salt, and pepper. The quinoa salad can be served warm or cold. Vegan burrito bowls. Ingredients: 4 burrito bowls or tortillas, 1 cup cooked rice, 1 can of black beans, drained and rinsed, 1 cup chopped vegetables, for example peppers, onions, corn, guacamole, salsa, vegan cheese, optional. Fresh coriander for garnishing, optional. Directions: heat the burrito shells or tortillas according to the package instructions. Add a portion of rice, black beans, and chopped vegetables to each bowl or tortilla. Add guacamole, salsa and vegan cheese as desired. The burrito shells and garnish with fresh cilantro, if desired. Fried tofu with broccoli and peanut sauce. Ingredients: 1 block of firm tofu, cut into cubes, 2 cups broccoli florets, 2 tablespoons vegetable oil, salt and pepper to taste. For the peanut sauce, 1/4 cup peanut butter, 2 tablespoons soy sauce, 1 tablespoon rice vinegar, 2 tablespoons maple syrup or agave syrup, 1 teaspoon grated fresh ginger, 1 garlic clove, chopped, a pinch of cayenne pepper, optional. Water to thin the sauce. Directions: fry the tofu in a pan with vegetable oil over medium heat until golden brown and crispy. Remove from the pan and set aside. The broccoli florets in the same pan until soft and lightly browned. Season with salt and pepper. In a small bowl, combine all the peanut sauce ingredients, thinning with water if necessary to achieve the desired consistency. Add the fried tofu and broccoli to the peanut sauce and mix well. Serve hot and garnish with additional peanut sauce, if desired. Recipes are slightly larger. Hunger. Vegan chili sin carne. Ingredients: 1 cup brown or green lentils, cooked. 1 can. 400 g. Kidney beans, drained and rinsed. 1 can. 400 g. Diced tomatoes. 1 onion, diced. 2 garlic cloves, chopped. 1 bell pepper, diced. 2 teaspoons chili powder, or to taste. 1 teaspoon cumin. Salt and pepper to taste. 2 tablespoons vegetable oil. Fresh coriander or parsley for garnish. Optional. Directions: heat the vegetable oil in a large pot and fry the diced onion and garlic until soft. Add the peppers and continue frying until they are soft. Add the chili powder and cumin and roast briefly until fragrant. Add the diced tomatoes, lentils, and kidney beans. Season with salt and pepper. Simmer the chili over medium heat until well heated and the flavors have blended, usually 15-20 minutes. Serve the vegan chili sin carne hot and garnish with fresh cilantro or parsley, if desired. Serve with rice or tortilla chips. Vegan chickpea curry. Ingredients: 2 cans, 400 g each chickpeas, drained and rinsed. 1 can, 400 ml, coconut milk. 1 onion, diced. 2 garlic cloves, chopped. 1 tablespoon vegetable oil. 1 tablespoon curry powder, or to taste. 1 teaspoon cumin. 1 teaspoon turmeric. Salt and pepper to taste. Fresh coriander for garnishing. Optional. Cooked rice or naan bread to serve. Directions: heat the vegetable oil in a large pot and fry the diced onion and chopped garlic until soft. Add the curry powder, cumin and turmeric and roast briefly until fragrant. Add the drained chickpeas and coconut milk. Season with salt and pepper. Simmer the curry over medium heat until it is well heated and the flavors have melded, usually 10-15 minutes. Serve the vegan chickpea curry hot. Garnish with fresh coriander and enjoy with rice or naan bread. Vegan potato and lentil soup. Ingredients: 4 large potatoes, peeled and diced. 1 cup green or brown lentils, washed. 1 onion, diced. 2 garlic cloves, chopped. 1 teaspoon cumin. 1 teaspoon paprika powder. 8 cups vegetable broth. Salt and pepper to taste. 2 tablespoons vegetable oil. Fresh chives or parsley for garnish. Optional. Directions: heat the vegetable oil in a large pot and fry the diced onion and chopped garlic until soft. Add the cumin and paprika powder and roast briefly until fragrant. Add the diced potatoes and washed lentils. Add the vegetable stock and mix well. Season with salt and pepper. Bring the soup to a boil, then reduce the heat. Simmer until the potatoes and lentils are tender, usually 20-25 minutes. Serve the vegan potato and lentil soup hot and garnish with fresh chives or parsley if desired. These hearty and filling recipes are perfect for when you're feeling peckish. Enjoy them as a main meal and get fueled. Side dishes and dips. Helene von Waldreben places great emphasis on diverse and flavorful side dishes and dips to make meals even more delicious. Here are some of the team's preferred approaches to preparing side dishes and dips. Fresh ingredients. The team favors fresh, seasonal ingredients to enrich the side dishes and dips with natural flavors and colors. The use of fresh vegetables, herbs, and spices is paramount. Flavor and variety. The side dishes and dips are not just meant to serve as accompaniments, but can also be enjoyed on their own. The team combines different flavors and textures to offer a balanced taste experience. Health aspects. The team ensures that the side dishes and dips are nutrient-rich. They often use healthy fats like olive oil or avocado and favor whole grain and gluten-free options to meet the needs of different dietary preferences. Creativity. The Hellene team at Waldreben isn't afraid of creative experiments. They enjoy reinterpreting classic recipes and exploring innovative combinations of flavors and textures. Adaptability. The side dishes and dips are designed to be versatile and easy to incorporate into different meals. The team often creates recipes that work well with main courses, snacks, or finger foods. Socializing. Side dishes and dips often encourage sharing and social interaction during meals. The team views them as an opportunity to enrich shared meals and enhance the shared experience. Overall, the philosophy of the Helene von Waldreben team when preparing side dishes and dips is characterized by quality, variety and creativity in order to offer a range of delicious and healthy options that make eating a special treat. Here are the recipes for mashed potatoes with vegan butter, cauliflower wings with barbecue dip and zucchini pasta with pesto. Mashed potatoes with vegan butter. Ingredients: 4 large potatoes, peeled and diced. 1/2 cup unsweetened almond milk, or other plant-based milk. 3 tablespoons vegan butter. Salt and pepper to taste. Fresh parsley or chives for garnish. Optional. Directions: place the diced potatoes in a large pot and cover with water. Bring to a boil, then simmer over medium heat until the potatoes are tender, usually 15-20 minutes. Drain the cooked potatoes and return them to the pot. Add the vegan butter and almond milk. Using a potato masher or hand blender, mash the potatoes, vegan butter, and almond milk until smooth. Season with salt and pepper to taste. Transfer the mashed potatoes to a serving bowl. Garnish with fresh parsley or chives, if desired, and serve with an additional slice of vegan butter. Cauliflower wings with barbecue dip. Ingredients for the cauliflower wings: 1 head of cauliflower, cut into small florets. 1 cup panko breadcrumbs, vegan. 1 teaspoon garlic powder. 1 teaspoon onion powder. 1 teaspoon paprika powder. Salt and pepper to taste. Vegetable oil for frying. Ingredients for the barbecue dip: 1/2 cup vegan barbecue sauce. 1/4 cup vegan mayonnaise. 1 tablespoon maple syrup or agave syrup. Directions: blanch the cauliflower florets in boiling water for about 5 minutes. Drain and let cool. In a bowl, mix the panko breadcrumbs with garlic powder, onion powder, paprika powder, salt and pepper. Toss the cauliflower florets in the breading mixture until well coated. Fry the breaded cauliflower wings in a pan with vegetable oil over medium heat until golden brown and crispy. Meanwhile, mix all the ingredients for the barbecue dip. The fried cauliflower wings with the barbecue dip. Zucchini noodles with pesto. Ingredients: 3 medium-sized zucchinis. 1 cup fresh basil. 1/2 cup pine nuts. 2 garlic cloves, chopped. 1/2 cup olive oil. 1/2 cup vegan parmesan or nutritional yeast. Juice of 1 lemon. Salt and pepper to taste. Cherry tomatoes for garnishing. Optional. Directions: the zucchinis into noodles using a spiral cutter. In a blender, combine the fresh basil, pine nuts, chopped garlic, olive oil, vegan parmesan or nutritional yeast, lemon juice, salt and pepper to make a pesto. Place the zucchini noodles in a large bowl and pour the pesto over them. Mix everything well until the zucchini noodles are evenly coated with pesto, with cherry tomatoes if desired. These 3 recipes are not only delicious, but also vegan, offering tons of flavor and variety on your plate. Enjoy. Broccoli and cheese nuggets. Ingredients: 2 cups fresh broccoli, finely chopped. 1 cup plant-based cheddar cheese, grated. 1/2 cup breadcrumbs, vegan. 1/4 cup vegan parmesan or nutritional yeast. 1 garlic clove, chopped. 1 teaspoon paprika powder. Salt and pepper to taste. 2 tablespoons plant-based milk, for example almond milk. 1/4 cup flour, for example chickpea flour, for binding. Vegetable oil for frying. Directions: combine the chopped broccoli, vegan cheddar cheese, breadcrumbs, vegan parmesan, chopped garlic, paprika, salt and pepper. Add the plant-based milk and mix again. This will make the mixture sticky. Add the flour and stir well to further bind the mixture into small nuggets or patties. Heat vegetable oil in a pan and fry the broccoli and cheese nuggets over medium heat until golden brown on both sides. Drain on paper towels to remove excess oil. Serve the broccoli and cheese nuggets hot. They make a delicious snack or side dish. Crispy potato wedges. Ingredients: 4 large potatoes, washed and cut into wedges. 2 tablespoons olive oil. 1 teaspoon paprika powder, 1 teaspoon garlic powder, 1 teaspoon onion powder, salt and pepper to taste, fresh parsley or rosemary for garnishing, optional. Directions: preheat the oven to 220 degrees Celsius and line a baking tray with baking paper. Place the potato wedges in a large bowl and toss with olive oil, paprika, garlic powder, onion powder, salt and pepper until the potatoes are well seasoned. Spread the seasoned potato wedges on the prepared baking sheet. Bake the potatoes in the oven for about 25–30 minutes, until golden brown and crispy. Turn occasionally during baking to ensure even browning. Remove the crispy potato wedges from the oven. Garnish with fresh parsley or rosemary, if desired, and serve hot. They make a delicious accompaniment to many dishes. These 2 recipes are both delicious and easy to prepare. Enjoy the broccoli and cheese nuggets as a snack or side dish, and the crispy potato wedges as a hearty accompaniment to your favorite dishes. Enjoy. Creative vegan sandwiches. Creative vegan sandwiches are a fun and tasty way to provide vegans with a varied and balanced diet. These sandwiches not only offer a taste experience but can also contain healthy ingredients that meet the nutritional needs of growing teenagers. The variety of breads, toppings, and sauces allows vegans to create their own individual creations and unleash their culinary creativity. From vegetarian or vegan options to meat and fish toppings, there are numerous ways to customize vegan sandwiches to their taste. With fresh vegetables, spices, and sauces, they can create unique flavor combinations while still ingesting important nutrients. Creative vegan sandwiches are perfect for school lunches, picnics, or as a quick and healthy option on the go. Vegan BLT sandwiches. Ingredients: 8 slices of wholemeal bread, vegan. 1 pack of vegan bacon, for example made from tempeh or seitan. 2 tomatoes, sliced. Leaf lettuce or baby spinach. Vegan mayonnaise, mustard, Optional. Salt and pepper to taste. Directions. Fry the vegan bacon according to the package instructions until crispy. Toast the whole grain bread slices. Spread vegan mayonnaise and mustard to taste on each slice of bread. Place a layer of lettuce or baby spinach on 4 of the bread slices. Then place the crispy vegan bacon slices on the salad. Place the tomato slices evenly on the bacon and season with salt and pepper. Place the remaining 4 slices of bread on top as a lid. Cut the vegan BLT sandwiches in half and serve. You can also wrap them in paper towels and enjoy them on the go. Peanut butter and banana sandwiches. Ingredients. 8 slices of wholemeal bread, vegan. 1 banana, thinly sliced. 4 tablespoons creamy peanut butter, vegan. 2 teaspoons maple syrup or agave syrup, optional. Directions. Toast the whole grain bread slices if desired. Spread the peanut butter generously on 4 of the slices of bread. Place the banana slices evenly on the peanut butter. If desired, drizzle some maple syrup or agave syrup over the banana slices. Place the remaining 4 slices of bread on top as a lid. Cut the peanut butter and banana sandwiches in half and serve. They are a sweet and nutritious treat. Vegan egg salad sandwich. Ingredients. For the vegan egg salad, 1 block of firm tofu, pressed and crumbled. 2 tablespoons vegan mayonnaise. 1 teaspoon Dijon mustard. 1 teaspoon turmeric. For the yellow color. 1 teaspoon paprika powder. Salt and pepper to taste. Fresh chives or spring onions, finely chopped. For the sandwich, 8 slices of wholemeal bread, vegan. Leaf lettuce or baby spinach. Tomato slices. Red onion rings, optional. Directions. In a bowl, combine the crumbled tofu, vegan mayonnaise, Dijon mustard, turmeric, paprika, salt, pepper, and chopped chives to make the vegan egg salad. Toast the whole grain bread slices if desired. Place a layer of lettuce or baby spinach on 4 of the bread slices. Spread the vegan egg salad generously over the vegetables. Place tomato slices and onion rings, if desired, on the egg salad. Place the remaining 4 slices of bread on top as a lid. Cut the vegan egg salad sandwiches in half and serve. They make a hearty and satisfying sandwich for on the go or as a lunch. These 3 sandwich recipes are versatile, delicious, and vegan friendly. They are perfect as a quick meal for vegans or anyone looking for delicious, meat-free options. Hummus and vegetable wraps. Ingredients. Tortilla wraps, vegan. Hummus, vegan. Leaf lettuce. Cucumber slices. Tomato slices. Pepper strips. Red onion rings. Olives, optional. Salt and pepper to taste. Fresh herbs, for example parsley or coriander, optional. Directions. The tortilla wraps slightly to make them more pliable. Spread a generous spoonful of hummus on each tortilla wrap. Place a layer of lettuce on each wrap. Then place cucumber slices, tomato slices, pepper strips and red onion rings on the salad. If desired, add some olives. Season with salt and pepper to taste and garnish with fresh herbs. The wraps tightly and cut in half. They are ready to serve. Plant-based chicken salad sandwiches. Ingredients. For the plant-based chicken salad, 1 package plant-based chicken, for example from soy or seitan, diced. 1/2 cup vegan mayonnaise. 2 tablespoons Dijon mustard. 1 teaspoon lemon juice. 1/4 cup celery, finely diced. 1/4 cup red onion, finely diced. Salt and pepper to taste. Fresh parsley or dill, chopped. Optional. For the sandwich. 8 slices of wholemeal bread, vegan. Leaf lettuce or baby spinach. Tomato slices. Red onion rings. Optional. Directions. In a bowl. Combine the plant-based chicken, vegan mayonnaise, Dijon mustard, lemon juice, celery, and red onion to make the plant-based chicken salad. Season with salt and pepper to taste. Optionally, add chopped fresh herbs. Toast the whole grain bread slices if desired. Place a layer of lettuce or baby spinach on 4 of the bread slices. Spread the plant-based chicken salad generously over the vegetables. Place tomato slices and onion rings, if desired, on the chicken salad. Place the remaining 4 slices of bread on top as a lid. The plant-based chicken salad sandwiches in half and serve. Enjoy this hearty and satisfying sandwich. These 2 recipes offer delicious, plant-based alternatives to classic sandwiches and wraps. They are easy to prepare and perfect for a quick meal or lunch on the go. Sweet treats. The Helene von Waldreben team and the search for the best vegan recipes. In today's world, where diets are becoming increasingly diverse and conscious, Helene von Waldreben embarked on a journey to discover and create the best vegan recipes. This journey was not only a culinary discovery, but also a journey of self-discovery and conscious lifestyle. The idea to search for the best vegan recipes arose from the Helene von Waldreben team's desire to promote a healthy, sustainable, and animal-friendly diet. Veganism is not just a way of eating, but also a philosophy of life that emphasizes respect for animals and the environment. The team wanted to not only enjoy delicious vegan dishes, but also show others how diverse, delicious, and satisfying a plant-based diet can be. The journey began in the team members' own kitchens, where they began preparing simple and delicious vegan dishes. This was the beginning of an exciting culinary journey that would take them around the world. The team was determined to explore the diversity of vegan cuisine, from the flavors of Asia to the traditional tastes of the Mediterranean. The search for the best vegan recipes took the team to various places around the world. In Thailand, they sampled delicious vegan curries and exotic fruits that delighted their senses. In Italy, they discovered the magic of homemade vegan pasta dishes and aromatic sauces. In India, they immersed themselves in the world of spicy spices and diverse vegan dishes like dal and aloo gobi. During their travels, the team also learned from locals who shared their knowledge of traditional plant-based dishes. They learned about the health benefits of a vegan diet and how it can protect the planet. These encounters inspired the team to further refine their recipes and develop a deeper understanding of vegan principles. However, the search for the best vegan recipes wasn't just a journey to faraway places. It was also a journey to the roots of plant-based nutrition. The team began visiting local farmers' markets and familiarizing themselves with the staple foods that form the foundation of a vegan diet. They learned how to use seasonal ingredients and incorporate sustainable practices into the kitchen. Helene von Waldreben developed a passion for creativity in vegan cuisine. They experimented with different textures, flavors, and techniques to develop innovative yet accessible recipes. They discovered that the vegan possibilities were limitless and that they could easily replace traditional animal products with plant-based alternatives. One key lesson the team learned during their journey was the importance of community. They met people who shared their passion for vegan cooking and became part of a growing global community of vegans and eco-conscious people. This community inspired them to share their recipes and insights and encourage others to try the vegan lifestyle. Today, after many years of searching for the best vegan recipes, Helene von Waldreben has developed a wealth of delicious and healthy vegan dishes. These range from savory main courses to sweet treats and desserts. They have created a vegan cookbook for children with over 200 recipes to help parents and children enjoy a healthy, animal-friendly diet. The search for the best vegan recipes was not only a culinary journey, but also one of self-discovery and environmental awareness. The Helene from Waldreben has learned that a plant-based diet can be not only delicious, but also sustainable and healthy. They hope their recipes will inspire people around the world to explore vegan options and make a positive contribution to the health of the planet. Vegan chocolate pancakes. Ingredients: 1 cup flour, for example wheat flour or whole wheat flour, 2 tablespoons cocoa powder, 2 tablespoons sugar, vegan, 2 teaspoons baking powder, 1 pinch of salt, 1 cup plant-based milk, for example almond milk, 2 tablespoons vegetable oil, 1 teaspoon vanilla extract, vegan chocolate chips or chocolate sauce, optional, fresh fruit for garnishing, for example berries, banana slices. Directions: in a large bowl, combine flour, cocoa powder, sugar, baking powder and salt. In a separate bowl, combine plant-based milk, vegetable oil and vanilla extract. Add the liquid ingredients to the dry ingredients and mix well until a smooth batter is formed. Lightly grease and heat a pan. Pour the batter into the pan to form pancakes of the desired size. Cook over medium heat until bubbles form on the surface. Then carefully flip and cook the other side until golden brown. Garnish the vegan chocolate pancakes with chocolate chips or chocolate sauce, if desired, and fresh fruit. Serve and enjoy. Healthy fruit popsicles. Ingredients: fresh fruits, for example strawberries, blueberries, mango, kiwi. Plant-based yogurt alternative, for example soy yogurt, agave syrup or maple syrup, optional. Popsicle molds and sticks. Directions: wash the fresh fruit. Peel it and cut it into small pieces. In the popsicle molds, alternate layers of fruit pieces and plant-based yogurt alternative. You can also add a little agave or maple syrup between the layers if you like it sweeter. The popsicle molds with the sticks and freeze for at least 4 hours or overnight until the popsicles are completely frozen. Before serving, briefly hold the molds under warm water to make it easier to remove the popsicles. The healthy fruit popsicles are ready to be enjoyed, especially on hot days. Energy balls with nuts and dried fruits. Ingredients: 1 cup mixed nuts, for example almonds, cashews, walnuts, 1 cup pitted dates, 2 cup dried apricots or figs, 2 tablespoons cocoa powder, 1 teaspoon vanilla extract, a pinch of salt, coconut flakes or sesame seeds for rolling, optional. Directions: grind the mixed nuts in a food processor or blender until coarsely chopped. Add the pitted dates and dried apricots or figs and continue blending until a sticky mixture forms. Are well blended. Form the mixture into small balls and optionally roll them in desiccated coconut or sesame seeds to cover them. Store the energy balls in an airtight container in the refrigerator. They are a great healthy snack option for on the go or as a quick energy boost. These 3 recipes are not only delicious, but also healthy and easy to prepare. They are perfect options for a sweet treat or a healthy snack for kids and adults alike. Enjoy. Chocolate banana muffins. Ingredients: 2 ripe bananas, 1/4 cup vegetable oil, 1/4 cup plant-based milk, for example almond milk, 1 teaspoon vanilla extract, 1 cup flour, for example wheat flour or whole wheat flour, 1/3 cup cocoa powder, 1/2 cup sugar, vegan, 1 teaspoon baking powder, 1/2 teaspoon baking soda, a pinch of salt, vegan chocolate chips or chocolate pieces, optional. Directions: preheat the oven to 180 degrees Celsius and line a muffin tin with paper muffin cups. In a bowl, mash the bananas, then add the plant-based milk, vegetable oil, and vanilla extract. Mix well. In a separate bowl, combine the flour, cocoa powder, sugar, baking powder, baking soda, and salt. Add the dry ingredients to the banana mixture and stir gently until well blended. Fold in the vegan chocolate chips or chocolate pieces, if using. Divide the batter evenly among the paper muffin cups. Bake the chocolate banana muffins for about 18-20 minutes, or until a toothpick inserted into the center of a muffin comes out clean. Remove the muffins from the oven and let them cool on a wire rack. Garnish with additional chocolate chips, if desired. The chocolate banana muffins are a delicious treat that is perfect for snacks, breakfast or desserts. Raspberry coconut ice cream on a stick. Ingredients: 1 cup fresh or frozen raspberries, 1 can of coconut milk, 2 tablespoons maple syrup or agave syrup, 1 teaspoon vanilla extract, a pinch of salt. Popsicle molds and sticks. Directions: place the fresh or frozen raspberries in a blender. Add the coconut milk, maple syrup or agave syrup, vanilla extract and a pinch of salt. Mix everything well until a smooth mixture is formed. The raspberry coconut mixture into popsicle molds and add the sticks. Freeze the molds for at least 4 hours or overnight until the raspberry coconut ice cream is completely frozen. Before serving, briefly hold the molds under warm water to make it easier to remove the popsicles. These raspberry coconut popsicles are refreshing and fruity, perfect for hot summer days or as a healthy treat any time of year. Enjoy these delicious vegan desserts. Party time snacks. Party snacks are an essential addition to any social gathering. These delicious and often finger-friendly bites are designed to delight guests and lift the spirits at parties and gatherings. Party snacks come in a seemingly endless variety and can be savory, sweet, crunchy, or creamy, depending on guests' preferences. Here are some popular party snacks. Chips and dips. A selection of crispy chips, tortilla chips, or vegetable sticks, served with a variety of dips such as guacamole, salsa, hummus, or spinach and artichoke dip. Mini sandwiches. Small, filled sandwiches or sliders with a variety of toppings such as smoked tofu, vegetables, vegan cheese, and sauces. Party platters. Attractively arranged cheese platters, fruit platters, vegetable platters and antipasti platters with a selection of vegan delicacies. Finger food. Small and easy to eat snacks such as vegan filled dumplings, mini quiches, puff pastry and vegan spring rolls. Sweets and desserts. Delicious sweets such as vegan cakes, cookies, brownies, chocolate fondue or fruit skewers covered in chocolate. Popcorn. Freshly prepared popcorn with various spices or spice blends, from sweet to spicy. Nuts and snack mixes. Mixed nuts, roasted chickpeas, trail mix, and other crunchy snacks that are easy to grab. Mini pizzas. Small, individual pizzas with vegan cheese and a choice of toppings. Vegetable chips. Homemade vegetable chips such as beetroot chips, sweet potato chips or zucchini chips. Sushi rolls. Vegan sushi rolls with vegetables, avocado or pickled tofu. Party snacks are not only delicious, but they also offer a great opportunity to showcase creative and delicious vegan options. They can be tailored to your guests' preferences and the type of party, whether it's a casual gathering, a birthday, a holiday celebration, or a social event. With a selection of vegan party snacks, you can ensure all your guests have something delicious to nibble on and enjoy, regardless of their dietary preferences. Vegan mini burgers. Ingredients. For the burger patties: 1 can of chickpeas, drained and rinsed, 1 small onion, finely chopped, 2 garlic cloves, chopped, 1 teaspoon cumin, 1 teaspoon paprika powder, salt and pepper to taste, 2 tablespoons oatmeal or breadcrumbs. For the burger buns. Mini burger buns. Vegan. Leaf lettuce, tomato slices, red onion rings, gherkin slices, vegan mayonnaise or mustard, ketchup. Vegan. Directions. Grind the chickpeas in a food processor until coarsely chopped. Sauté the chopped onions and garlic cloves in a pan with a little oil until softened. Then add the cumin and paprika and toast briefly. Add the chickpeas to the pan and mix with salt, pepper, and oatmeal or breadcrumbs. The mixture should hold together well. Form the mixture into small patties and fry in a pan with a little oil until golden brown on both sides. Cut open the mini burger buns and top with lettuce, tomato slices, red onion rings, vegan mayonnaise or mustard, ketchup, and gherkin slices. The fried chickpea patties on the buns. Put the bun lids on top and serve. Crispy vegetable spaghetti. Ingredients. Spaghetti. Vegan. Vegetables of your choice. For example, zucchini, peppers, broccoli. 1 cup panko breadcrumbs. Vegan. 1 teaspoon garlic powder. 1 teaspoon onion powder. Salt and pepper to taste. Vegetable oil for frying. Directions. The spaghetti according to the instructions on the package. Drain and set aside. Cut the vegetables into thin strips or pieces as desired. In a bowl, mix the panko breadcrumbs with garlic powder, onion powder, salt and pepper. Fry the vegetables in a little vegetable oil until they are soft and lightly browned. The cooked spaghetti and mix well. The panko breadcrumb mixture over the spaghetti and vegetables and continue frying until the breadcrumbs are crispy. The crispy vegetable spaghetti immediately. Vegan mini quiches. Ingredients. For the dough. 1 stroke 2 cups flour. Vegan. 1 stroke 2 teaspoons salt. 1 stroke 2 cup vegetable oil. 1 stroke 4 cup cold water. For the filling. Vegetables of your choice. For example, spinach, mushrooms, peppers. 1 cup silken tofu. 1 teaspoon turmeric. 1 stroke 4 cup plant-based milk. For example, soy milk. Salt and pepper to taste. Directions. For the dough. In a bowl, mix flour and salt. Add the vegetable oil and cold water and knead into a dough. The dough into a muffin tin to form mini quiche shells. For the filling. Cut the vegetables of your choice into small pieces and fry them in a pan until soft. Blend the silken tofu, plant-based milk, turmeric, salt, and pepper in a blender until smooth. Divide the fried vegetables among the pastry shells and then pour the tofu mixture over them. Bake the mini quiches in a preheated oven at 180 degrees Celsius for about 20-25 minutes until golden brown. Remove the vegan mini quiches from the oven and let them cool slightly before serving. Vegetable sushi rolls. Ingredients: nori seaweed sheets, sushi rice, cooked and cooled, vegetables of your choice, for example, cucumber strips, avocado, carrot strips, peppers, soy sauce, vegan, wasabi and pickled ginger, optional, sushi mat and plastic wrap, for rolling. Directions: place a nori seaweed sheet on the sushi mat with the rough side of the sheet facing up. Lightly moisten your hands and take a handful of sushi rice. Spread the rice evenly over the nori sheet, leaving about 2 centimeters free at one end. Place thinly sliced vegetables of your choice in the center of the rice. Lift the mat and roll the nori sheet, rice, and vegetables into a tight roll. Press gently to ensure the roll stays together. Cut the sushi roll into bite-sized pieces and repeat the process with the remaining ingredients. Serve the vegetable sushi rolls with soy sauce, wasabi, and pickled ginger as desired. Vegan mini taco cups. Ingredients: small tostadas or taco shells, vegan. Vegan taco filling, for example seasoned soy granules, black beans, vegetables, guacamole, vegan. Vegan cheese, optional. Seasoned vegan sour cream, optional. Fresh coriander or parsley, for garnish. Directions: heat the small tostadas or taco shells according to the package instructions. Prepare your vegan taco filling. You can use seasoned soy granules, black beans, vegetables, or your favorite taco ingredients. Fill each tostada or taco shell with a portion of your taco filling. Top the mini taco cups with guacamole and vegan cheese, if desired. Add a small amount of seasoned vegan sour cream on top. Garnish the mini taco cups with fresh cilantro or parsley. Serve the mini taco cups as delicious party snacks or appetizers. These two recipes are great options for parties or social gatherings. They offer a delicious and appealing way to enjoy vegetables and flavors, and can be customized to suit your guests' tastes. Disclaimer: the information provided in this book is for informational purposes only and is not intended as a substitute for professional medical advice or treatment. The author and publishers of this book assume no liability for any damages or losses resulting from the use of the information presented in this book. The information contained in this book is based on the current state of medical knowledge at the time of publication and is subject to change due to new findings or developments. It is recommended that you consult a qualified physician or medical professional before using any therapies, treatments, or lifestyle changes mentioned in this book to ensure they are appropriate for your individual situation. The author and publishers of this book assume no responsibility for the accuracy, completeness, or timeliness of the information provided in this book. Any decisions made based on the information presented in this book are the sole responsibility of the reader. The use of any products, techniques, or advice mentioned in this book is at your own risk. It is recommended that you consult a qualified physician or medical professional before using any new products or therapies to discuss potential risks or side effects. By purchasing and using this book, readers agree that neither the author nor the publishers can be held liable for any direct or indirect damages or losses resulting from the application of the information presented in this book. By purchasing and using this book, readers acknowledge that they have read and agree to the above disclaimers, rights and ownership notice. This audiobook is published and distributed by Testberichtinstitut LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testberichtinstitut LLC. Testberichtinstitut LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testberichtinstitut LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testberichtinstitut LLC. All rights reserved.